Welcome to Medical Marijuana and Wellness. Tonight's topic is Ask the Experts, and we have a number of experts that are joining us tonight to help answer your questions. And this is a bit of a different webinar than we've ever done before, because really we're going to take questions that we've received prior to this webinar and answer those for you, as well as taking any questions that you have during the webinar. Please feel free to go down, and there's a Q&A button at the bottom of your screen. Please feel free to put your question in there. We'll be more than happy to answer that particular question. And again, our goal is to really help you understand what is medical cannabis, how it affects you, get your question answered, and hopefully we have some experts that can address your point and get you the answer. So tonight I'd like to introduce our experts, and I want to thank them all. First of all, I want to thank you as an audience for watching. It means a lot to us, but more importantly, we also have some experts here to really help us get your questions answered. I want to start with the doctor that's with us, Dr. Michelle Beasley. Doctor, welcome, and thank you very much for joining us. Tell us, where are you located and what do you do?
Hey, Mark, thanks for having me. So I am in Pensacola, western edge of Florida, and I've been a medical cannabis physician for it'll be 10 years in August. So I started early on. I've been a physician and owner with MMTC for 9 years, and I see patients full time. So I'm a pediatrician by training. So it was a big change going from seeing all kids to now I hang out with mostly adults, but I enjoy
Sure.
the education part.
And
Um,
a bit of a change of venue too from pediatrics to cannabis. So
yes,
subject matter. Well, thank you very
less.
much for joining us.
Thank you.
Also joining us is Amy Green, our nurse that's going to joining us tonight. Amy, you're an RN and you work for MMTC, is that correct?
I sure do. So always great to be here, Mark. Thank you so much. I am a patient educator at our Villages office, and I really focus on new patient education, so helping patients get started with medical cannabis.
So that's really great. Thank you. Thank you very much for joining us. And so complementing this is a couple of representatives from Surterra who could take a look at answering questions from a dispensary standpoint. So if you notice, what we've done is we've taken doctors' inputs, nurses' inputs. We have, of course, from the dispensaries, and then, of course, we want to be able to get your questions. So please feel free to ask. I'm going to start with Emily. First of all, you were the one who've been very influential in helping to coordinate a lot of these. Tell us a little bit about who you are and what you do.
Absolutely. So my name is Emily Waxman, and I am the outreach coordinator at Surterra, which means that I get to go out into the community and be able to begin partnerships with amazing folks at MMTC, as well as other groups and places and people that would like to partner so that we can share our wealth of knowledge with folks about cannabis and how it might be able to help them in their daily lives.
Great, great. Well, thank you for joining us. And also, Marley French, you're with Surterra. I think you're in Bradenton. Is that correct?
Hello, yes, I'm Marley French, and I'm the managing the Bradenton Wellness Center of Surterra. So we're a medical dispensary, and we have about 43, 45 locations in Florida right now. So we're here to help you and help you with your cannabis journey and lead you in the right direction.
That's great. Well, listen, we've got a fairly distinguished crowd. I want to, by the way, let me introduce myself. I'm Mark Matoza. I host this webinar series. I'm a certified medical cannabis practitioner, healthcare and medical cannabis practitioner, and really been at this for approximately 10 years, much like you, Dr. Beasley. I got involved in it early, and I've spent a lot of time researching and putting together a lot of information on medical cannabis. And so I want to thank everyone for joining us, both the audience and also the experts. And without further ado, let's kind of jump into getting some of your questions answered. And let's start with the questions that were asked prior to your submitting this. I do want to point out, though, doing a little bit of housekeeping. This webinar is being broadcast both on Zoom and also on live on YouTube. You will receive after this webinar a copy of this recording that is going to be placed on YouTube. You'll get a link to that, as well as any presentation material that comes up that we need to pass out to you. We may have some references and things like that that come into play. But more importantly, I want to mention to you, this is a webinar that's done for information purposes. It's not here to give you medical advice. If you need medical advice, please contact your doctor, your medical marijuana doctor, or your medical marijuana practitioner. And I hope that helps you quite a bit. And again, don't forget to hit that Q&A button at the bottom of the screen to help get your questions answered or get your questions asked so we can get your questions answered. So that being the case, let's jump into the first question. So the first question is, what is the endocannabinoid system? And I think, Emily, you kind of provided some information about this, didn't you?
Oh, this is Marley's.
Oh, Marley, excuse me.
I did. I'm always interested in learning about the endocannabinoid system. So, the endocannabinoid system is a regulatory system in your body that is just like the nervous system that we know about and all the other systems that in your body. But the endocannabinoid system is the most newly identified, and it's a regulatory system that monitors all the systems in your body, like your sleep, your mood, your appetite, your pain levels, and it's kind of like a warning system, and it's trying to maintain your body's homeostasis and a equilibrium. And what we found in cannabis is that there's a phytocannabinoid that is exactly the key, just like our natural cannabinoid in our body, and it will help regulate your system with the cannabis plant.
So this really helps you regulate really all your bodily functions, your mood, your appetite, inflammation, things like that. It really works in parallel with the nervous system. Is that correct?
Yes, exactly. Everyone thought the nervous system was like the main system, and then this was identified, and now we have a whole new exploratory field here.
Sure. When your nervous system says, Houston, we have a problem, one of the places it handings the problem to is the endocannabinoid system in your body to help fix it, which is kind of interesting. That's there. It's really the backbone to medical cannabis and something that's really, really important. Let's jump to the next question.
I think Michelle had something to
Oh,
add.
excuse me. Sorry, Michelle.
I was nothing. I just think it's interesting. So if you look back evolutionarily, every animal that has a backbone has an endocannabinoid system. So if you think about that level of organisms, is important in development and, like you said, homeostasis. So I think of it as a thermostat. So if something's too high or something's too low, the endocannabinoid system is just helping keep us in the middle and balanced.
Well, and by the way, the word homeostasis means keep in balance. I think that's something that we tend to use it all the time, and for somebody that's new to the industry, that's something that's a good term to figure out. But it was something that was really not known by doctors. It was really found when the researchers started done by Dr. Meshulam in Israel. Really he started in the 60s, but it was not until the 90s that it became very popular as far as getting the information out. So I would say when you talk to your medical doctor, he may not know what the endocannabinoid system. I think Dr. Beasley, you weren't trained on this when you were in medical school, were you?
No, the only thing we learned about cannabis was as a drug of abuse. Nothing as far as in the normal human body and every body system it's present. So it's amazing how it was. It's an example of you have to be a lifelong learner. Things change, and we need to evolve our education as well.
Sure. And I think, Amy, the same thing was true when you were going through nursing school. Do you get much information on cannabis?
No, there's zero information on cannabis in nursing school. It's pretty much the same thing that Dr. Beasley said. It's a drug of abuse.
Yeah. And yet turns out to be anything but that. And I do want to point out that although it's been labeled that way, recent, change of tone by the U.S. government is now basically talking about making it a Schedule III drug versus Schedule I. And in there, they actually state that cannabis is medicine. So for the first time, literally since 1937, the United States government is recognizing the medical benefits of cannabis, which I think is a big move forward. There's a lot more that has to be done. There has to be a lot of, let's just say, meat put on the bone to really make it really happen. But the fact we're heading in that direction, I think, is a very positive thing that's really there. So let's jump to the next question. It says, how do I know which terpenes I should look for in a product? Amy and Marley, you had some comments on this. Let's start with Amy. This is really a topic you talk about quite a bit.
It is, yeah. So when I am educating new patients on how they're going to approach using products, of course, it's always going to be start at the lowest possible dose and then work your way up gradually to what works for you. But in addition to that, it's also once you find a product that works well for you, ask for the COA or the certificate of analysis for that product. And what you're going to look for when you're looking at that COA is the terpene profile. When you use products regularly and say you try different products from different dispensaries or even different products from the same dispensary, they'll all have a slightly different terpene profile. And you might notice one's working better than the other. And you might notice, hey, this particular product that works really well has a higher terpene profile for, say, linalool. Sorry, I blanked on every terpene right now. Say it has a lot of linalool, and you find that when you're using that product, it's very helpful for you. what we would normally suggest then is when you're going to purchase a product in the future, ask for the COA in advance of buying the product, and you can see what the terpene profile is before you purchase the product and try and really hone in on the ones that you find work well for you.
Mm-hmm. Cool. Marley, you had some comments as well.
Yes. So when you're first trying cannabis or you're learning about all the different aspects of the cannabis plant, it can be overwhelming and a lot of information at once. And you're like CBD, THC, terpenes, what are all these things? And I know that it's like an overwhelming thing to swallow at first, but terpenes I refer to as the essential oils of the cannabis plant. And think about it like that. All plants have terpenes in them. So all, fruits and plants that you eat, and those are what give its taste, aroma, and effect. So the cannabis plants have that different terpene profiles, like Amy said. And what we can do is, like she said, identify different products that work for you. We can identify the highest terpenes in those and find other products maybe that are high in those same terpenes, or switch to a different ratio of terpenes. And we have patient journals where you can record all the different products that you try, and you can keep track of what works best for you, what didn't work very well, what you liked or didn't like. And then we can kind of hone in on those different terpenes and maybe be like, okay, if this one was giving you a little higher level of paranoia, we might lay off of something that's got that high sativa-like terpene profile and move to a different ratio.
Sure. Here's a chart of the top 8 terpenes that you'll find. There's actually over 120 different terpenes in cannabis. These are kind of the top 8 ones that are contained in a lot of the cannabis plants. But in there, you can see the different characteristics. Amy, maybe you can help understand, how do you determine which terpene works for various conditions?
Sure. So this chart is just going to be a general overview. Your mileage may vary, is always what I like to tell patients. But we can have a general idea of how a terpene might be helpful. For example, linalool. Linalool is what makes lavender smell like lavender. And it's already a scent that we know brings relaxation, maybe sedates you a little bit. And it has a similar job when it's in a cannabis plant too. It helps with relaxation, sedation. It has a lot of different things it can help with. And yeah, so it's just finding the product that has the terpenes that you need. And it's the trial and error of trying different products with different terpene profiles to find the specific one that works well for you.
I think also, Marley and Emily, do you have in your dispensary, do you have a chart that maybe maps these terpenes to various conditions?
We do. We have a really nice, easy terpene chart that kind of identifies like what this kind of looks like, but it shows like the effects and like the associated like taste and smell to these different terpenes. And a lot of our patients, the first thing they do is take a picture of it. We have it on the wall, but we do have it printed out. And normally I send my first time patients home, or anyone who has questions about terpenes or wants to learn more about the cannabis plant. I send them home with a journal, a terpene chart of their own. And
Right. So, one thing I see commonly in not even necessarily new patients, a lot of patients shop by THC percentage, because patients tend to think of it as if they're getting more for their money. So if you're buying an eighth of an ounce of flour and it's 30% THC versus 15%, you're getting more with the 30% THC. But to me, you're missing out on the terpenes. So if you think about it, a plant only has so much energy. And if it's really cranking out the THC, you're not going to get as good of a terpene percentage. So you might not see as much difference in this with the effects, because there's just not as much of a higher percentage of terpenes if it's really spending all its energy making the THC. So it's not that, we obviously want the THC too, but I would encourage, especially new patients, don't shop, you're not necessarily getting a better value or a better product with a higher THC percentage. Sometimes a more moderate THC percentage. The analogy I use with my patients is alcohol. If I'm going out for a nice steak dinner, I'm not ordering Everclear because it's the highest alcohol percentage. I want a nice glass of wine that complements my steak. because that's the point, is not to be as drunk as can be. So that's one thing. Amy had mentioned the COAs, the THC percentages and the terpene percentages. You'll see they kind of, if one's up, the other one's down. So that's something to look at when you're journaling.
Yeah, I think it's important to point out that the medical value of cannabis comes from the terpenes and the flavonoids. The cannabinoids do help, but it's really the terpenes that bring most of the medical value. And I think you're right on. When you're looking for a medical product, you complement and pay attention to the terpenes. I think when you're looking for a recreational product, and Dr. Beasley, maybe you can help me here, I think that's where it gets into people looking for the highest THC, kind of like I want to get drunk kind of thing. If you're a rec customer, you're looking for what they call the bang for the buck. How much THC am I getting for my dollar? But in a medical side, we kind of look at it a little bit different. We're looking at how much relief we get for the dollar. Is that a fair statement?
Right. Or side effects. Too much THC can make someone paranoid.
Yeah.
But that same patient might be able to do a lower percentage THC with some good relaxing terpenes and have a much better experience than, the high 20s, low 30% THC.
Sure. I know that when I look for a lot of my, it's kind of interesting. The last couple of years, when I start looking for a cannabis product, I look for the percentage of terpenes in it rather than the percentage of THC, which is kind of an interesting switch because I'm looking for the medical side of it that's there. So.
Oh, Mark, I did want to add to that. Michelle said it perfectly. The THC is going to give you that high feeling or that pain relief, but the terpenes are what lead the direction of where that feeling is going to go. If you want to be asleep or you need pain relief, that's one direction. Or if you need pain relief, but you need to be awake, that's another direction. And the terpenes are what direct that. I would also, any dispensary that you go to, inquire about terpenes. One great thing about Surterra is that we present the terpenes on the menu immediately. And we are also boasting some really high terpene percentages lately, over 4% terpene percent. And I believe that the effects last longer with the highest terpene. And we still have really high THC percentages on some of those strains. So, and we're doing really well with that terpene percent right now.
That's great. That's good to know. Cool. Let's move on to the next question, see what we have here. The question is why isn't there a standard dose? Why isn't there a standard starting dose for medical cannabis? That's an excellent question. I think we'll start with the nurse to help us out. Amy, you got some comments here?
I sure do. So what I normally tell every new patient is what works for one person is not guaranteed to work for another person. That includes product and dose. So just because, your friend across the street is using a full edible and that works really well to help them get to sleep, in a new patient taking that same full edible might have a really bad time because the dose might be far higher than what they actually need. So this is why we always recommend for every single product that to start at the lowest possible dose and then gradually work your way up across multiple doses to a slightly higher dose. The idea is that we want to help you find the minimum dose possible to get you the benefits that you want without the negative side effects.
Sure.
It is trial and error to get there. That is kind of the pits of it, is that it's the trial and error. But that trial and error allows you to try a variety of products and see what works well for you.
And I should point out, if you go to our YouTube channel, that's YouTube/Marijuana Aware, we have a number of dosing webinars that walk you through the whole dosing process. So if you're kind of new to this whole thing, or if you haven't dosed before and you want to learn more about it, please feel free to check those out. That can help you walk yourself through the dosing process to really help you find not only your therapeutic dosing level, but also your sweet spot. And I hope that helps quite a bit. Emily, you had some comments.
Yeah, I just, everything that Amy said is exactly what I was basically going to say. It's just there's so many different factors that take into account what we're taking and how I'm going to ingest something and react to it will be completely different from how anyone else on this panel would. And I always really try to make sure I say that to all the patients that I'm speaking to, because a lot of them will say, well, they had seen this product and a friend of theirs took this, or my mom took this, and they've all been maybe patients for a long time. And so they've kind of have built up a little bit of a tolerance there. Whereas, a lot of times I'm speaking to brand new patients that just have not had an opportunity to really dabble with anything. And so I never want to start somebody or recommend that they start with something that is, really strong anything. It's always that famous saying that we just start low and go slow. And I make sure that any patient I'm speaking to, especially new patients, are aware of this. And, once they talk to the bud tenders or their guides, they get a much better idea as to really where the best place for them to start is. And we do a great job at Surterra with making sure that we're recommending patients the best place to begin.
Sure. And Marley, you've never heard this question in your dispensary, right?
Oh my goodness, this is everyone's. Every person who's never tried cannabis or who hasn't tried it in a long time, or maybe they were like, well, I used it in college. That's one of my main things I hear from new people, that I used it 20 years ago, but it's completely different. And maybe, it's very intimidating. One great thing about our products is we offer the ratio-based products. So the CBD is the non-psychoactive and the THC is the psychoactive part. So with the ratio products and there being a range of them, you can always, if you have some trepidation, you can start on the very low end and start with like a very high CBD product that isn't going to affect you in that way. And then maybe that might not be enough. You can move up forward, but you can do it on a gradual scale where it's comfortable for you. I always say that a typical starting dose is 5 milligrams of THC. Like I say, typical starting dose. We offer micro dose products, like our mints and even our lozenges are a 5 milligram product, but it's half CBD, half THC. So that's also still like a micro dose, and even smaller dose than that. So
Sure.
I recommend, like Emily said, start low. We can always add more. And then CBD is a natural, I would say if you ever felt like you had too much THC and you have that feeling right away where you have that paranoia or some kind of bad side effect, taking CBD can reduce that effect. Also eating something spicy and just making sure you consume something where you're home, you're in a safe place, you don't plan on going out or traveling or driving for the first time trying it, and then maybe on a full stomach.
Okay. Dr. Beasley, you had a comment about titration.
Yeah, so I often see patients will start, getting help with sleep's the first thing. So they might start with an indica gummy, terpenes more like linalool, myrcene, and then they're wanting something for energy. It's important, if you're going to start trying a sativa gummy for daytime, you don't start at your 10 milligram dose that you're doing at bedtime, because you can be, your sensitivity can be different to different terpenes. Your daytime dose might be 2.5 milligrams. That 2.5 milligram mint might be great for your daytime anxiety, but you take 10 milligrams of THC at bedtime to help you sleep. If you take a 10 milligram edible in the daytime, you might feel paranoid or get sleepy, because enough THC will make you sleepy regardless. So it's important, when you try new things, to kind of use that same start low, dose low, even though you're an experienced cannabis user for different indications. The thing Marley was saying with the spicy, that is actually a terpene effect. So beta caryophyllene, or caryophyllene, some people say, it binds to the THC receptor, the CB1 receptor. It competes with the binding. So it kind of kicks the THC out when you get too much THC. So sniffing black pepper can help, or eating something spicy is why that helps take that paranoia away.
That's a good point. That's a good point. This is very, very critical. Dosing is really critical. And I do want to remind everybody that who's watching, I compare it to alcohol. You have friends who have one drink and they're done for the night, and we have other friends. I have friends who drink the whole bottle and they're just getting going. that has to do with your metabolism, and that affects cannabis as well. When you ask the question, why can't you have a starting dose? I think it's because our metabolism are different. And I think, Dr. Beasley, when you prescribe, when you're in your practice in pediatrics, you would give a minimum dose from a pharma standpoint to a patient initially to start. Is that correct?
Right. So there are drugs that you can dose by kilogram, so many milligrams per kilogram.
Right.
But that's not the case with cannabis. And, you can
Right.
have a big 250-pound, man that's just fine with their 2.5 milligram mint. Where, I have 80-year-olds that are taking, their 25 milligram capsules at bedtime. Then they're, 100 pounds wet. So it's not a direct, milligram per kilogram dosing with cannabis.
Yeah, but I think also, you kind of learn right away when you start using cannabis. This isn't something that takes you 2 years. I mean, you'll get to know within the first week or two, especially probably the first week, what works and what doesn't work. I mean, it's. I know that in myself when I started getting relief. I had herniated disc in my back from an auto accident. When I started getting relief, I noticed it. I knew I was getting better, and when I got past that sweet spot, I knew when I was there. So it's something that's very natural. Hard to explain unless you've gone through it, but when you go through it, you believe in it. Let's put it that way. Something
I
that's there.
I wanted to say that's why I recommend the journaling. I know it seems silly at
Good point.
times to write this down, but it's just like when you're working out, you might not know what weight you used last time. You want to see if you have progress or if that worked well for you. And having the journal and kind of just identifying a couple of key factors to products. Well, if you bring that to us the next time and you identify what was you liked about it, what you didn't like, we can move forward and then dial in on what's perfect for you.
Yeah, no, that makes a lot of sense. Journaling makes an awful lot of sense. When I had my knee operation, I was doing some journaling, and what I found out was CBD was better to help me reduce my pain than THC. And when I talked to my medical cannabis doctor as well as my medical doctor, it became very clear by relieving the inflammation, I was relieving the pain. And the journaling would not have led me to that conclusion unless I would have been doing that. And I think that's really, really critical to point that out. Cool. Let's run on to the next question that we have here. Why do some cannabis products make anxiety and PTSD or PTS worse? Amy, I'll kind of let you, Doctor. That's kind of right up.
It is. So we do have a lot of patients that come in and we do education with them, and their main problem that they're trying to deal with is PTSD. The biggest thing that I always tell people with PTSD is everything is going to be very dose dependent. Too much of THC, too much of a certain terpene may trigger PTSD symptoms in patients. And it does, again, take some trial and error to find out what terpenes a person is sensitive to. Some patients may find limonene is too uplifting for them and it may trigger anxiety for them. Same thing, they may find that when they're using linalool, they're not getting that feeling. And so it is going to be finding the dose that's not too much, and it's going to be finding a terpene profile that's not triggering their negative symptoms. And again, it does take the trial and error. And just like Marley was saying, this is a perfect time to do journaling, especially when you're getting down into the nitty gritty of, I found this product made me paranoid. And then it's just being reflective about how the product worked for you. But journaling, hey, this product gave me a negative side effect. And then you try another product with a slightly different terpene profile while still being conscientious of the dose of THC. There is always the chance if a person with PTSD takes too much cannabis, like THC, they could absolutely have a negative effect. And it could be triggering their PTSD. It could just be their reaction to feeling overwhelmed or stoned and being unfamiliar with the feeling. But dose is always a huge consideration whenever we consider anxiety or PTSD symptoms.
And if you start getting overwhelmed or something, you can take some CBD to counteract the effects of this THC. Is that correct?
Yes. So CBD is going to bind to the same receptors as THC and knock some of them off of those receptors. And it can help reduce the headiness that some patients get from THC. That being said, CBD will not completely negate the effects of THC. It's not like a perfect one-to-one and they cancel each other out. It's more, it might make the stoned, heady feeling more tolerable or more comfortable, but it's not going to make that feeling go away. Only time can do that.
Right. Now, there's one other thing that I think that's important. We should have probably brought it up in the last slide. We talked about finding your sweet spot, but how do you get started? How do you, Amy, when you start someone in the villages, what's the recommended dosing that you start with?
So it actually depends on the product that they're most interested in. Every single product is going to have a little bit different dosing starting places. For a product like an edible, we generally recommend starting with a 10 milligram edible and cutting them into quarters. So you're actually starting with 2.5 milligrams. It is a very low dose. And for some patients, it might not be an effective dose for them. And that's okay because it's a starting dose. Same thing if a patient wanted to start on tincture drops, we might recommend starting with the bottom mark on the eyedropper. So about 0.25 milliliters. Right. Again, very small dose. But the idea is we're trying to find the minimum dose possible that works for that patient.
That really works well. Dr. Beasley, you had a comment as well.
Yeah, and I think Marley touched on it before too, but if you're going to try a new product for anxiety or PTSD, try it at home somewhere you're comfortable. I've heard horror stories, someone, they're worried about trying to deal with the theme park. And so they try something to deal with anxiety when they're about to, walk into Disney or Universal. And if you're in an unfamiliar environment, that's going to increase anxiety. So, never try anything for the first time when you're not at home. I've had patients, they wind up in the grocery store and, get paranoid. Whereas, the same medicine at home, it's okay. The other thing is, inhalational forms don't last as long. So, some patients don't want to inhale, they don't want to smoke or vape. But starting out, it doesn't last as long. So if it's something you don't like, it wears off, in 2 to 3 hours versus 6 to 8 if it's too much of an edible. So sometimes patients will start doing more inhalation, and then as they get comfortable, you can kind of titrate those milligrams over, how many puffs of a vape pen are you doing? I'm going to do an edible, over that 6 or 8 hours instead of so many puffs of a vape pen. It's not exact science, but you can play with it.
Yeah. And I think what this graphic's, by the way, showing is that once you hit your sweet spot, your therapeutic dosing level, if you go past that, you'll begin to bring back some of those effects. And that's when you've gone past your dosing level. So that's when you want to back off. That's when you want to go down. Like, for example, when I went to a full milliliter on a tincture, I found out that I was not getting the same relief as 3/4 of a milliliter of a tincture drop. So I think that's where you really want to back down. That's the key to that particular dosing strategy that's there. Don't keep going up. Find out where you start. When it does get worse, bring it back. And you're right. If you're really taking too much of it, it will make that particular condition worse. That's safe to say?
It absolutely can. How do we explain it? So you've gone past the point of being comfortable and you're into the area of experiencing negative side effects. And the negative side effects that we always talk about are a stoned, heady feeling, feeling like you're a little bit discombobulated or woozy. Stoned, heady feeling. It can be very uncomfortable if a person is not expecting to be stoned, or if they have not experienced that feeling before, if they've not been at that level before. It can be very disconcerting, but the good thing about cannabis is that feeling does go away with time, and there's no negative side effects from the actual plant medication. You take it, it's done, and that's it.
That's a good point.
I wanted to add, so when patients come in and they've tried something that said they gave them anxiety, we always review the terpene profile. Most of the time it's something that's a sativa leaning product. So sativas are going to be more of that uplifting daytime effect, but some of them can be ultra stimulating, and the stimulating terpenes are what could help elevate that anxiety level. So anyone that says I experience a lot of anxiety with sativa, or I've experienced a lot of anxiety, or I just have a lot of anxiety. We always try to recommend a hybrid, which is like a balanced terpene profile type of cannabis product or an indica product, so that we steer away from those very high, make possibly anxiety inducing terpenes.
Mm-hmm. That's a good point. Good point. Good point. Let's move on to the next question. This is, I think we're digging down on some very interesting topics here. Question is, can I use marijuana without smoking? And is smoking cannabis worse for me than other kinds of products? Dr. Beasley, you have some specific comments on this.
Right. So, traditionally cannabis has been smoked because the most common form in the plant, the THC acid, is not psychoactive. So, in ancient times, people figured out burning it led to the psychoactivity. So traditionally, cannabis has been smoked because if you just eat the raw plant, now there are health benefits to the raw plant. It's actually 10 times the anti-inflammatory, antioxidant properties, but you don't get the psychoactivity. So traditionally, it has been smoked. So, only in modern times have we gotten into being able to extract it and make oils and then turn it into different things. People like inhaling because it works fast. So, something triggering a PTSD, panic attack. When you inhale, it works in 2 to 5 minutes. Downside is it only lasts 2 to 3 hours. So that same combat veteran using cannabis in the smoked form to deal with a trigger might want to use an edible for bedtime for sleep, because if they only smoke before bedtime, the cannabis, your liver's really good at getting rid of the THC. So 2 to 3 hours, it's out of your system. And then the 3 a.m. nightmares still come, where you take an edible. The reason the edibles or the, edibles, tinctures, capsules, your gut is not as efficient. It takes longer to absorb. So because your gut's only letting it leak into your bloodstream slowly, your liver can't get rid of it until it's already in your bloodstream. So that's how the edibles and the capsules last longer. So most people layer it. It's not one form. It's, if you need quick relief, you might inhale. If you need longer duration, you might use oral products. And it can be a combination. So someone with chronic pain might take something oral first thing in the morning, but 11 a.m. they go get, lift the groceries and their back pain is exacerbated. They can throw some, inhaled cannabis or vape on top of it, as breakthrough symptoms. But I certainly have had patients over the years. They absolutely, they're former tobacco smokers. They're worried it'll trigger them wanting to smoke again. So they're just, I don't want to inhale, and that is certainly fine. We have tinctures, capsules, gummies, topicals. People forget about the topicals. Lotions are great. I think hands, feet, and knee arthritis pain. And then the patches for more, my analogy when I'm seeing patients is vaping or smoking is like a mountain peak. You feel it quickly, but it doesn't last very long. The edibles, the capsules are more like a hill, so less steep of a curve up, but more time under the curve. And then the patches are like a low flat road, takes the edge off the symptoms, but doesn't really impair you. So you can mix and match them. Like I said, if you're trying to figure out what works, sometimes the inhalational route is nice, because if you don't like it, you're not stuck with it for very long. Smoking versus vaping, there's a lot of confusion. A lot of people don't realize that you can vaporize flower. And to me, that is, that's the special sauce. When you vaporize, you really only need 350 to 400 degrees to get the terpenes and get the THC activated. When you're combusting, when you're smoking, you're up at 800 to 1200 degrees, and it could be overkill. You lose cannabinoids, you lose terpenes to the smoke, to the combustion. So when you vaporize it, it can be a lower temperature and it can be more efficient. Some people will say they actually buy less flour. They don't have to spend as much money because they don't, it's more effective in smaller amounts. And then there's also, vaping oil. So the concentrate. So, that can be the dabs, the wax, the shatter, but also just a vape cartridge. There are more. So can y'all tell I like analogies? My analogy for this is spaghetti sauce. So, you can, spaghetti sauce is better when your mom makes it and it's got, onions and basil and oregano and meat. That plant has all those parts naturally, over 500 different chemical components. The more we process it, we try not to lose it. But when you have to heat things evaporate. Even just drying the plant, you cut the plant off, you hang it upside down to dry, you're losing some of those terpenes to that process. And so you can wind up getting what I call like the Chef Boyardee pizza sauce. It's like tomatoes and water. Yes, they're both tomato sauces, but they are not the same thing. So I have certain patients who certain symptoms, they can use the more, they can use their topicals or their capsules or their edibles, but certain symptoms, they've got to smoke to get relief. One patient doesn't like smoking, but smoking is the only thing that gives her an increased appetite. She can use the capsules for pain, anxiety, but if her physician starts fussing at her for being underweight, she begrudgingly goes and buys flour to smoke until she gets her weight up, and then she stops again, until she drifts her weight back down. So I'm a fan of layering, but I hope I answered that, smoking versus vaping.
You did a good job of that. I think there's one other comment I think, Amy, that you wanted to make, and that's about dry herb vaporizers, because I'm a huge fan of dry herb vaporizers, and it really allows you to set the temperature to really target your cannabinoids and terpenes. Amy, your comments on that?
Yeah, absolutely. I'm just going to jump right on what Dr. Beasley said. So when you're vaporizing whole flower, you're generally using something called a dry herb vape. All it is, it's like a little oven, and it heats up the cannabis with conduction and convection, and then it releases all of the naturally occurring oils in the plant. So the nice thing about doing that is you are getting all of the naturally occurring oils that on the plant. So all of the terpenes, all of the cannabinoids, all of the flavonoids, you're getting all of that instead of just THC oil, which is just THC oil. So just like Dr. Beasley said, you're getting like the good homemade real stuff spaghetti sauce instead of like the watered down version of it. And that can be a lot more helpful for patients, especially when they're trying to do things like pain control, anxiety, inflammation. So absolutely.
Yeah. It's interesting, Dr. Beasley, you brought it up, and Amy, you brought up the dry herb vaporizers. I'm not I haven't smoked my life. I just was not a smoker, but I have found that if I use a dry herb vaporizer, I can really target the exact terpenes and cannabinoids that really help me with my pain, because having herniated discs in my neck, pain management is one of the top things I'm really managing. And I found it, I've become a great fan of dry herb vaporizers because of that. It's very different than smoking tobacco. I just want to make that really clear. There's a night and day difference between smoking cannabis, and especially if you're using a dry herb vaporizer, it's a much safer. You still are putting something in your lungs, and you always got to be careful of that. There's no getting around it, but it's a lot safer and it's a lot more controllable. That's something that's really, really important. It's there. Cool. Good. So let's jump into the next question. Where can I learn about cannabis being used for cancer and chemotherapy? This is an excellent question. Emily, do you want to jump in on this one, because this has a lot of dimensions to it?
Yeah, it does. Lots of levels on this one for sure. So I guess I'll first start off with just saying, when I'm talking to patients that are dealing with cancer, I first start off saying that the cannabis is it's not going to cure the cancer. What cannabis is going to do is it's going to be able to help with all of the side effects from what you're dealing with. So when you're speaking to cancer patients, they're going through chemotherapy, and chemotherapy is so tough on the body. And so it's dealing with nausea and being sleep deprived and pain and all these other things that your body is going through. And so cannabis can help with that. Even for a lot of folks, as Amy mentioned, or our doctor mentioned, I think, about someone who's losing weight because of the chemotherapy. And so cannabis can kind of help bring back that appetite a little bit. So I always try to recommend cannabis as an option for folks that are going through chemotherapy.
Sure.
And certainly also a huge piece too I'll recommend is the anxiety piece. Of course, going through something as scary as cancer, I would imagine, brings on a multitude of feelings. So cannabis is a great way to be able to be introduced, to be able to help with the side effects that they're dealing with. And I'm hearing from a lot more patients that I'm speaking with that it does seem that oncologists are a lot more open now to bringing cancer in. I've spoke to some patients where almost like the medical doctors will be speaking with the cannabis doctors. And so being able to get something conversation and everybody on the same page with that, I think is phenomenal. I think a lot of times people revert back to the stigma of cannabis, and so they try to hide that they're utilizing cannabis along with their other medications. And so
Sure.
I really try to make sure to stress to folks to really be open and honest about it, especially if you're getting relief from it. And so this has just been something where I've really tried to help guide patients in letting them know about really what their options are. And again, not kind of going back to the smoking piece, letting them know about all the different options too. You know, it doesn't necessarily have to be smoking anymore. It can be doing the topicals, doing the tinctures, doing patches, things like that, that will just kind of help take that edge off for them. And so I always try to make sure it's just guiding them to be able to put another tool in that toolbox of theirs to just kind of help with everything that they're going through. And I was so glad to see that Lee had added a note about RSO,
Right.
because Rick Simpson oil is now just since that's been introduced, it's just helped a multitude of folks that are really needing that high level of a pain reducer. And that is something that patients can utilize and use just even a small, like rice amount of RSO. I've spoken to some patients that have used it, just putting a small piece on a cracker, and that's been enough to really kind of help get them through what they're going through. So
Sure.
I'm really thrilled that that was added on there. That's a great product, and something that we certainly carry as well. So that's
I do want to comment. Rick Simpson made Rick Simpson oil, and he did it about 25 years ago. But if you walk into a dispensary today, it may be called FSO because you're using a different
Right.
using basically. In 20 years, we've come up with a better cutting agent. So FSO and RSO is really pretty much the same products.
Yes.
It's there. That's an important key point. I think the other thing I want to point out is I know when my mother 8 years ago was diagnosed with cancer, we put her on an RSO treatment. By the way, she's still here. She's going to turn 97 next month.
Great.
Uh,
Yay.
and she keeps telling me, Mark, I'm alive because of you, which I find interesting. But
Oh, I love that.
the
That's sweet.
point I'm making is that one of the things she told me was the anxiety. When she first heard she had cancer, I mean, her anxiety level went through the roof. And I come from an Italian Portuguese family, so obviously there's a lot of passion and emotions. But it really has helped her with her anxiety. You want to comment on that a little bit? Because that's really key, I think, in the whole area of cancer, not just to help you with the chemotherapy, but also to help you with the anxiety part of it.
Oh, absolutely.
I would say like having a positive mindset and just keeping positive energy flowing through your body. I don't know if that sounds kooky to most people, but negativity breeds negativity. And when you're in a proactive, positive mindset and when you're in an anxious space, your body is not able to heal. So it's like in a fight or flight. So you want to come at your illness or whatever you're dealing with or anything in life with a plan, a positive mindset, and a calmness about you. And that helps heal. You know, I've heard of all kind of different people that go to retreats where they can isolate and meditate and just focus so that their body can focus on the healing aspect instead of focusing on the anxiety aspect.
Sure, that's really good. Good question. We got a live question. We got a live attendee question from anonymous that says, "I am taking chemo for breast cancer following a double mastectomy. Can I vape, or should I do edibles?" Dr. Beasley or Amy, do you want to comment on that?
Yeah, so I was answering in the chat because I thought I was being efficient. I didn't mean to be on the side. I'm OCD and can't stand the red bubbles popping up, so I have to address them. Yeah, so my answer was, if it's a fresh surgery, a lot of people, smoking or vaping, especially when you're new at it, you tend to get a lot of coughing, or not a lot of coughing, or you can get coughing. And if you're fresh post-op, coughing can be painful. You want to take deep breaths. You don't want to get pneumonia. Deep breaths are important, but you don't want to torture yourself either. So that would be, I think after surgery, after mastectomy and with chemo, plenty of my patients vape or even smoke, but you just want to be careful with the coughing if it's just a fresh surgery where it'd be painful.
But also, they brought up the point of, can you do an edible? I think you're talking about really two interesting things, because the vape lasts maybe an hour or two, maybe 3 hours, as far as a duration. Where if you take an edible, it may take you an hour or two before it kicks in, but it's gonna last anywhere between 8 to 10 hours. I think that's an important distinction.
Right, and you can layer it. So again, people
Right.
starting out, a lot of times they like inhaling because you get that immediate feedback. You know if it's working. You know if it's working. You put the pen down and you don't take more.
Sure.
The edible, you kind of have to be patient. You don't want to double dose your edibles. That's where people get in trouble. You take an edible, you don't feel anything in 30 minutes. Sometimes it takes up to 2 hours, especially if you have an
Sure.
empty stomach. So you don't want to double dip on anything oral.
Right.
One other thing that Mark, you mentioned the tinctures for your knee. New patients, I don't usually recommend the Theragels, the capsules, because you can't cut them.
Right. Good
They're
point.
great, but a bottle of tincture, even if you don't love the texture of the tincture, a lot of people,
Sure.
I tell them just to put it on food, a dry cracker or cookie, if they don't like the oiliness of the tincture. But you can titrate that dose, a quarter dropper full to a half to three
Right.
quarters. Whereas the capsule is the capsule, you can't cut it because it'll drip out. It's a liquid gel.
Sure.
So for first purchases, I like either the edibles, like Amy said, so we can quarter those easily, or the tinctures
Mhm.
for the oral routes.
Yeah, I think that's important. Amy, you had a question. You had a comment.
Yeah, I just wanted to add one thing. They're kind of an intermediate product that I recommend for some patients if they're not maybe totally on board with vaping, but maybe they need something just a little bit faster. Some of the oral sprays can be a little bit faster onset time than an edible.
Right.
It's about the same as using a tincture, so not super quick, but it is going to be faster than an edible. There's an oral spray that you can spray into your tongue. There's a nasal spray, and there's an inhaler that looks just like an albuterol inhaler.
Sure.
The nice thing about those products, though, is unlike a vape, they're not heated. So a lot easier on your throat, less chance of coughing, especially if you just had surgery and you're trying to keep your stitches intact.
Hmm. Yeah.
Yeah.
That's a good point.
I wanted to add on the fast acting element. We do get a lot of people that are like, I'm automatically a no on smoking or vaping, which is completely understandable. But they still want a fast acting effect. We offer a fast acting gummy edible. It's the Wana brand, which is a Colorado based brand, very well known, very well established. They offer a fast acting edible gummy, which is you would feel within 5 to 15 minutes. The duration of the effect isn't as long as a typical edible, so I would say about 2 to 4 hours, but it is nice that it's a fast acting and it's a gummy, nice, easy to take. It's water soluble. That's how it absorbs in your body. So that's what the difference is with a regular edible. It absorbs in your stomach rather than the intestine. So we do offer that. And if you look up the Wana company, it's wonderful.
Yeah, that's a good point. That's a really good point that's there. So I think to answer your question about the person who went through the breast cancer, you can vape and you can use edibles, but there's also other forms that you may want to take a look at. It really depends on what you're comfortable with. I know that one of my good friends, Jeff Dumont, who's is a PTSD question, he likes to smoke because it's therapeutic. He likes rolling the joint. It's not the cannabis itself; it's the process. So there's a lot behind this. I mean, some people have rituals, and it just depends on what your ritual is, but. It's something that the answer is yes, you can. And I think Dr. Beasley and Amy, thanks for bringing those up. That's a good point. One of the other things I want to point out also on this particular subject, the nice part about a lot of Surterra products is you have ratioed products. You can increase the same amount of THC. For example, you may have a 1-to-1, one THC, one CBD, but you can go all the way up to maybe 9-to-1 and higher than that. That's really, really important. I know that when I did my knee operation, I didn't realize how important it was to have more CBD than THC, and the ratio products really helped me quite a bit for that. You may want to comment on that because that has something to do with really helping you dial in and really relieving this particular the condition that you're trying to really overcome.
Yeah, definitely. So I generally recommend ratio products for newer patients, especially for daytime, because it does give them that opportunity to have some THC, but not so much that it's going to make them not able to do what they need to do during the day.
Sure.
Ratio products are that kind of stepping stone to going to slightly stronger products. And it
Right.
is a great way to make that transition to stronger products.
Right. Really helps quite a bit. Don't underestimate the benefits of that. It really helps you tune things in. Super. Let's run to the next question. Let's see if we can, the next one that comes up to play. It says, what happens when I get to the dispensary? Excellent question. I get that quite a bit. How do I walk in? What do I do? We have a couple of dispensary experts here. You want to take this one? Marley, you want to start with it?
I will. So I've been working in a medical dispensary for over 6 years now. And the first thing is, well, you would obviously need to get your medical marijuana license for our state, Florida, from the state of Florida, and see the medical marijuana doctor to get your prescription. So those are some things that people might not understand at first. But once you have your prescription with the doctor and you have your medical card, you come to the dispensary. We are here to guide you. We are here to help you and support you in your journey. So what you would do is just come on in, check in with somebody at the dispensary. In our dispensary, you come right up to the bud tenders, and we're here. All of our bud tenders are educated on our products. We're always learning about different terpenes and different products, new strains that are coming out, and everyone on the team is genuinely interested and passionate about cannabis and the natural element of like healing your body without using chemical products or traditional medicine. So we're very into what we do. We're here to help. We like to help. We like to hear you come back and tell us that you were healed or I'm saying that you found the relief that you were looking for from what you got. That's my goal, is to have someone come back and be like, thank you so much for recommending that. It worked so great for whatever their issue was. So when you come in the dispensary, you just check in. We take your ID. So it'd be like any Florida or, passport ID, your medical card. We just get you checked into the system. We go over whatever you'd like to go over. So we can do a private consult if you need to. We can go over terpenes, whatever is comfortable for you. And we'll try to pair you with whatever products would be working best for you, and send you home with a packet of knowledge of information that you can go home and digest and look over and kind of get comfortable with.
I think an important part of this is, I don't think a lot of people understand, and I'll talk about Surterra. You do consultations, is that correct?
Absolutely. So
and why don't you mention that, because that's really key, especially not only if you're a new patient, but if you've been using cannabis for a while, it really helps to go through and have a consultation done. Why don't you explain what that is?
A consultation is just like, you can even do it a private. So every medical dispensary in Florida has a private consultation room where you can go into the privacy of a room with just you and the bud tender and communicate about, maybe if you don't feel comfortable talking about all your medical ailments in front of other people or just in a private setting, you could do that if you'd like to. But the point of it is to explain what you're looking for the products to achieve. I always ask, what effects are you trying to achieve, and where do you stand have you used cannabis before? Those are my first questions when I ask somebody, are you new to cannabis? Have you ever tried this before? And it's not an interrogatory type of thing. A lot of people are like, I don't know. And I'm like, you don't have to be scared to say, yes, I've used cannabis before. I just want to know where you are and on your journey and what you're trying to achieve with the product. So everybody is different with their journey.
Yeah. And I think, like you mentioned, most of the quality dispensaries, I do offer consultations. I think that's what's really important.
If you ask questions and they're not interested in jumping on those questions and helping and point you in the right direction, come to Surterra.
Yeah. To find a dispensary that does, and Surterra, I know, does a great job of that. I did my consultation with Surterra, and I found it to be very fascinating. I learned something. Let's put it that way.
Thank you.
Really thank you. Well, thank you. That's really there. Emily, do you have any questions, or you have any comments you want to make?
Yeah, I'll just go just underneath it, asked if do I need to learn about cannabinoids to pick out a medical marijuana product at a dispensary? You can do whatever research before, but please know when you do arrive at the dispensary, all of our guides will be more than happy to explain all of the products and what's going on with them, and what the cannabinoids are or the terpenes, and explain it all without getting it too much of confusion. Again, I know that we've been talking about journaling throughout this conversation that we've been having tonight. Again, I'm thinking that almost all the guides will recommend that that's a very important thing to do for new patients, especially just to be a nice reminder. But again, we even have these little journals too that we can hand out too. So just wanted to make mention of all those couple of side things as well.
Sure. And I should mention, I'm just saying, is my natural tendency when I got involved in this is, look, I'm a guy. You said journaling, I was kind of like doing what? And then when I had my auto accident and my knee operation, I found it to be absolutely critical. I may not have liked what I was doing up front because it was just something I wasn't used to doing. Not that it was bad, but I found that the benefits of it was tremendous, especially when I bent back and look over a week or two, and I could see where I was really trying to address my pain and also my inflammation, and really it made a marked difference in being able to help me and help other people help me. Let's put it that way. It was a good.
Absolutely. Yeah, because cannabis isn't just, take two and call me in the morning. It's it's a very personalized product for each and every one of us. So the journaling just really helps tremendously with that.
Yeah, I wouldn't walk away from journaling right up from it. I would try it. Let me just say, try it. You'll be shocked how it really helps you with a particular condition.
So true.
Yeah, cool. Let's run to the next question. See what we have. Okay, so question is, and it's a good question here. Why can't I sleep even with CBD gummies that work for other people? That's an interesting question. Marley, you want to tackle this one? Because this is a sleep is one, I think sleep and pain management are some of the top reasons why people use medical cannabis.
Yes, I think that some of the misconception is that just CBD alone is going to be that all, consuming pain, sleep, everything. And the CBD does work in conjunction and can be relaxing depending upon your symptoms. I would definitely say that CBD is not going to be the most effective if you really need sleep support. We've just recently launched a huge line of CBN products, which is another newly discovered cannabinoid, which I'm sure one of the medical professionals can speak to. But CBN is a sleep support cannabinoid in cannabis that is very highly effective in that sedating, relaxing effect. I would say products high in myrcene terpene is also a body effect and relaxing effect. And we also tend to recommend mainly indica products that are going to also be a more body feel, a more relaxing, a more sedating effect. Some are more sedating than others. But our line of CBN products I've heard from so many people that say, oh my gosh, that puts me fully asleep all night long. I don't wake up in the middle of the night. I've heard so many great reviews about it. We do offer the Dream line, which was our original ratio-based Surterra Wellness products, which is a specifically formulated terpene profile for sleep support. So we do offer that, and that was like our original classic, Coca-Cola. But that was working great. And now that we have the new CBN products, it's like another level up, and it's amazing.
I should point out something, and Dr. Beasley, I'm going to tap into you for a second to help me with this answer. You brought up something earlier, Dr. Beasley, about the duration. When you're using certain products, like a vape pen will last for 2 hours, where an edible lasts all night. I think one of the things, if you want to sleep through the night, is to introduce yourself to or use a product that will last the whole night. And this would be what I call an edible. It may not be a gummy, but something like that. I think that could help.
Ingestible, yeah, something go into your gut. And what Marley was saying about the CBD, I think a lot of new patients, they think of CBD as the medical cannabinoid and THC is the fun one. And so people are afraid to use THC, they want to be medical. So they're like, oh, I'm just going to use the CBD products. But THC is better for sleep than CBD alone. Interesting thing is CBN is the breakdown cannabinoid. So CBD and THC both become CBN as it gets old. So, kind of the lore was, someone had some smokable cannabis in their sock drawer and forgot about it and smoked it, a year later, and it made them so sleepy. And chemically, it was because the THC had become more CBN.
Sure.
CBN's great for people who don't like that high feeling. You can get sleepy with less THC. So if you don't want to feel that impaired, high, drugged feeling, my thought is you're at home, you're about to go to bed. Who cares if you feel a little euphoria? You
Right.
might giggle more at the TV show you're watching. We probably need more giggling and laughing in our life. Like that's not, I just say as long as your spouse doesn't take video of you, you're fine. Uh,
Better
but
not.
yes, but it's just people like their instance. I don't know, preconceived notion is CBD is medical, THC is recreational, but it's
Right.
it all can be medical, it all can be recreational. But I think
Sure.
these combination products are nice because you can think of it as a THC sparing effect.
Right.
And then the other thing I don't want to confuse people, but just like, all people don't have the same reaction to medication. So, as a pediatrician, the classic story would be, families about to take their kid on an airplane ride for the first time. So they're going to give the 2-year-old Benadryl for the flight to make them sleepy, so they don't have to keep the kid entertained. And lo and behold, that kid will be the one Benadryl makes hyper. And then they're freaking out on the airplane ride, screaming, crying, the whole plane's upset. Adults can have the same cannabis reaction, so there is a small, and interestingly, it correlates with having the opposite Benadryl reaction. It's probably a GABA receptor issue. So there are, I know these terpenes, I feel like, these new patients might be getting overwhelmed talking about terpenes. You don't have to be an expert on terpenes to come into the dispensary and start. Like,
Right.
we can help
Good
you.
point.
I said in the chat, it's like drinking from a fire hose. Like, you can't learn all of it all at one time. So, but it's more, you learn from your bud tender, you go back to your follow-up with your doctor, you call the nurse at the doctor's office, if something doesn't work. It's not a one time you learn it all and then you're an expert and you know how to do it. But the adding the CBN, I lost my train of thought there. With the CBN, the CBD, the THC, and if the indicas, like Marley said, we recommended indica edible for bedtime. If it's not working, I had a great high school friend I was seeing as a patient, and we had tried everything under the sun to get her to sleep. It wasn't working. So she went to the dispensary and she's like, well, if I'm going to be tired and can't sleep at night, I might as well get a sativa gummy and give me some energy during the day. And she literally said she woke up 4 hours later drooling. Like the sativa gummy put her to sleep. And, that's how we figured out she had the paradoxical reaction. So,
Sure.
nothing's 100% and you just have to kind of be able to go with the flow a little bit. Just like, if humans were all made the same, we would have one antidepressant. How many are on the market? Like everyone's
Sure.
receptors are different in our body.
Totally.
I love when I have the spouses of the patient and they like completely different it's about 50-50 if they even shop at the same store. Use different products, have different reactions. And like you said earlier, the neighbor with your same back pain, same product doesn't work. So you just kind of have to have a little bit of an open mind with it. It's definitely not one size fits all.
Yeah, that's a good point. Sleep is important, but I think again that duration is really key, which you were pointing out. And I think use a product. One of the mistakes I made when I had my knee operation was I was using a tincture drop, and the tincture drop wore off after 4 to 6 hours. So if I took a tincture drop at 10 or 11 o'clock at night, I wake up at 3 or 4 in the morning, and I was in pain. And so that's why paying attention to the duration of the product that you're using is really key. Because even though you wake up in the middle of the night and you can titrate again, it'll take you 20 minutes or an hour to really fall back asleep. And that really disturbed my sleep patterns. Let's put it that way. Something that made a lot of sense. Cool. Let's jump on to the next question and see what we have here. I think we're finished with a lot of the pre-webinar questions. I think we have some questions now that are coming from the audience. What does it mean from medical cannabis to be moved from Schedule 1 to Schedule 3? That's a good question. And I think, Dr. Beasley, why don't you kind of take this one? That's kind of what in your wheelhouse.
Right. No, it's interesting. And you gave the disclaimer at the beginning of the webinar, this is not medical advice. I will say I'm not an attorney. This is not legal advice.
Yeah.
But it's interesting. So, the 1970 Controlled Substance Act, when it started, it was to classify drugs based on risk. So risk of addiction, risk of abuse. So Schedule 1 is considered no medical benefit. And Schedule 5 is, there's concern like cough syrup. Cough syrup can be abused, but less likely than say oxycodone. So the original committee for the Controlled Substance Act from the DEA reviewed the medical information, and it was recommended that cannabis be put in Schedule 3. Interestingly, it was during the time of the Vietnam War, And our president at that time correlated the smell of marijuana with the people protesting outside the White House. And so they went against the scientific committee recommendation and put cannabis in Schedule 1, no medical benefit, even though the scientists back in 1970 still said Schedule 3. So we've
Sure.
been stuck there. And so if the government considers something no medical benefit, they're not going to approve studies to prove medical benefit. So that's
Right.
where we've been stuck. We don't have the studies on, does it help cancer pain, neuropathic pain? Does it help the vomiting with cancer? Does it help MS, neuropathic pain? Because, at least from the United States, because our government wouldn't approve it because the party line is no medical benefit. The other thing with Schedule 1 and Schedule 2 drugs is the companies, the Surterras, the MMTCs of the world, aren't allowed to take normal tax deductions like other businesses. So me as a physician, if I buy new furniture for the lobby or a new computer, those are all deductible expenses. The medical marijuana companies have never been able to take those, and that makes their business a lot more expensive. So they in essence pay about a 70% tax rate, which
Sure.
matters for customers. So it's hard to reduce the price of a product if your 70% of your earnings are going to taxes.
Sure.
So this had been recommended. The Biden administration, I think it was 22 or 23, asked Health and Human Services to look at the data again, and they recommended a change to Schedule 3. But DEA has to do it. So there were scheduled to be hearings for the DEA to hear it, I think in 2024. They picked 25 people to speak at the hearings, and then there were lawsuits for the people who did not get picked to speak, sued because they weren't getting the right to speak, and so that held up the hearings. So fast forward, end of 2025, the president told DOJ to look at this again. So
Mhm.
we finally got it in April. The attorney general did an executive order and
Mhm.
interestingly said any FDA approved cannabis product, which would be like Marinol, which is synthetic THC that's
Mhm.
FDA approved, Epidiolex, which is the FDA approved CBD, and any product compliant with a state medical cannabis program is now Schedule 3. Recreational cannabis is still Schedule 1. And to me, that is very bizarre because it's the same plant. How are the risks different? It actually turns out it goes back to some of our international treaties. So we have treaties with other nations that prohibit the legalization of recreational drugs. So
Mhm.
they could not move recreational cannabis, or then we're out of compliance with treaties with other countries, which is bizarre. So right now we're in the situation where we have an order that says medical cannabis is Schedule 3, recreational cannabis is still Schedule 1. There will be hearings, I think June 29th,
Mhm.
the
That's
DEA
correct.
are doing hearings on figuring out how to make recreational cannabis move to Schedule 3. Schedule 3 drugs have to be managed by the federal government. So if the and I sent the links to the actual order if anyone really wants to deep dive into these, but it's actually going to require the medical marijuana companies, they have to get a DEA license. Walgreens, CVS, they all have DEA license. So now all the medical marijuana companies will have to have DEA licenses. And it has to be, the federal government has to have control over the product. So there's going to be some system where, say, Surterra has to sell their product to the federal government and then buy it back from the federal government. And that makes it compliant as a Schedule 3 drug. Um, of course, the federal government gets a piece. There will be a fee related to it. So the advantages of Schedule 3 is the companies can get the tax deductions, which hopefully helps with patients with prices. And it opens up research because now we're in a class where there's medical benefit. And that's what you were saying earlier, Mark. So we can have NIH fund studies looking at the medical benefit of cannabis. Um,
Sure.
you know, Going into the gun issue, I think we kind of alluded to ATF, Alcohol, Tobacco, Firearms, is in charge of the buying of new guns. A couple weeks ago, they released that they are looking at their form. So there is a form 4473 is the form you have to fill out to buy a new gun. It currently says, are you addicted to or use illicit substances? This includes marijuana, which may be legal in your state, but is federally illegal. There is now a proposed form change where that will say,
Right.
including recreational marijuana, which may be legal in your state, which is federally illegal. So it carves out that a medical patient would be able to buy a gun. And just to be clear, I'm not saying this is true today. This is a proposed form change. It's under public review, I think, till July 7th.
Right.
but that could go forward where, medical cannabis patients don't have to worry about their gun right. In the 20 years we've had medical cannabis, guns aren't going into people's homes and being seized. But it could be an issue, you get pulled over for speeding and you have cannabis and a gun in your car. There can be legal problems with that. So
Sure.
the other thing is with TSA, will we get ability to travel between states if it's not federally illegal? Just like you can take your oxycodone state to state. So again, it's not as ineffective now, but the door is open to those conversations, and that's what those hearings, the end of June into July, will be discussing.
Yeah, you brought up a very important point. These executive orders are nothing but a piece of paper, and I'm not diminishing the importance of them. All I'm saying is they are not law. They're just a stated direction to go. And I say that because right now I don't want anybody going to the airport thinking they can fly with medical marijuana, and I certainly don't want people. That's not a good idea. And really, cannabis, when they say I'm going to make it Schedule 3, there's that old saying, "Where's the beef?" Where's the legal structures behind it so that the police officers and the TSA agents and those people have some guidelines to go through. And I called TSA and I talked to them right after that statement came out. And the agent I talked to in Orlando, who was a gentleman who kind of ran that facility, said, we found out about it through the press. Our agents have no guidelines as to what to do.
Right.
So we don't know what to do. And his comment was, don't do anything until we figure out what's going on. I mean, don't put them in a very negative position, especially after they haven't been paid for 2 months. It's not a really good
everyone's
idea.
doing the best they can with the information they have. The other wrinkle with Florida, because Florida, we have to do everything different. Jody James of Florida Can let me know that Florida is one of 8 states that does not automatically accept schedule changes from the federal government. So we actually have to, either our attorney general or our Florida legislature has to vote to adopt it.
Right.
So we're going to have to wait and see. And I sent emails, I sent my local representatives and to our attorney general's office. Haven't heard anything back. But there is precedence. The Florida Attorney General, when Epidiolex came out, there was an order from the state of Florida Attorney General to make it Schedule 5 instead of Schedule 1. So we have the precedence, but it doesn't mean it'll happen with THC. The other factor with the federal DOJ executive order is there's already been lawsuits filed against it. So some of the prohibitionist groups are trying to block it. So, as we've seen in Florida with some of the MMTC licenses, a lawsuit happens and everything stops until the lawsuit gets figured out. So if anything, things are more confusing, but at least there's more conversations going on.
Well, it's a very positive stated direction. And it's rallying people to head in a particular direction, which is important. I think it's important to point out to folks, we're not there. Okay. I mean, we want to be there. I think there's a lot of people I know that work in this industry that want to be there, but you got to let the process, it's going to take a year at least, I think, to really sort this out and really get it there. And again, I don't want anybody heading to the airport or doing something that's going to get them in trouble. That's not what's there. I do want to point out, and it's something that's really critical, and maybe Amy and Dr. Beasley, you can help here. I think the key is being able to open up research in the medical cannabis. There's been more research done on medical cannabis in the last year than in all the years before, but it was all done outside the United States. It was done in Israel, it was done in Canada, it was done in England, it's done in Germany, South Africa. There's a number of places that do research, and great research. Dr. Cristina Sanchez has a lab in Spain just dedicated to cancer and cannabis, and she's run that lab for 26 years and has put out a lot of research on it. But being able to recognize that research and being able to adopt it is a different story. So I think that's an important part. I think that's one of the keys. I think really helps your business is to be able to have medical research to really hang your hat on when you're recommending products. Is that something you're looking forward to?
Yes, and FDA approval. So, FDA is that, so this is DEA, this is the legality. It is not FDA approved. FDA, you have to have a bunch of research for something to be an FDA approved drug. And just remember, cannabis will always be more complicated because it's 500 different chemical components. The FDA would much rather, that's how we got Epidiolex. It is a crystallized CBD with no terpenes, nothing else in it. It made it through the FDA hoops, but we have no hope of getting it through without research. And now with the
Right.
Schedule 3, we can get funded research, because before they only wanted to approve research that proved it was Schedule 1, no medical benefit.
Right.
That was the only research coming out of the US. Now we
Right.
can look at benefits if we get the Schedule 3, which then we can get the FDA to review it. And that's what leads to insurance coverage, because insurance doesn't pay for any drug that's not FDA approved.
Right.
You know, my hormone pellets I do for menopause, they're
Right.
not FDA approved, so I'm out of
Right.
pocket.
Right.
Even though those are lethal drugs in the United States.
Right.
So, we have no hope for insurance coverage for these medicines until we get down the FDA pipeline.
Right. Yeah, it's a process, and it's frustrating it takes so long. But the point is, the process started, and I'll give credit to Biden for getting it going. And candidly, it was cut off with the new administration and then restarted. So I'll give them credit for restarting it. I think it's important that we really head down that path and get some answers as to what this product can and cannot do. For medical professionals like yourselves and myself and that type of thing. It's really there. So cool. I think let's jump on to the next question. I think we have another one coming up. Okay, so here we have some just questions that have really come up. First question is, I think the dispensary folks that might want to take on this one. Is it possible to find RSO tinctures in a 1,000 milligram form?
I would say the best option is our FSO syringe. That's going to be about 850 milligrams for an entire syringe. If 1,000 milligrams for a single dose is extremely high, I don't know anybody that takes a dose that high. I always ask people how much of something they're taking to just get them a financial budgetable type of product. Like if they're coming to me, oh, I have to take 10 gummies of the 10
Sure.
milligram gummies to get the effect that I'm trying to achieve, I always point them in the direction of a more financially, reasonable type of product that's a concentrate. 1,000 milligrams, you might have a absorption issue in your body that
Right.
you're not getting the benefits of the product, which is a whole nother issue. But we do offer, I would say, up to an 850 milligram syringe for a reasonable price. Other than that, we have 1,000 milligram packages of Theragels, which are a 40 count. They're 25 milligrams each, and that's 1,000 milligrams total. The state of Florida does have a regulatory limitation on edible and milligram products.
Cool. I think when I saw this question, I think the question I had was, are they going to try to take it all at once, or is it something that you want to have in a bottle and you take maybe 100 milligrams at a time? I don't know which way. I do know that I have found 1,000 milligram, actually more than that, RSO tinctures. But I actually found them in California, and I found them on an Indian reservation, believe it or not, who is specializing in this. They did a great job of this. But I think that really 1,000 milligrams is something. I think Dr. Beasley and Amy, that's kind of a high concentration. I think you probably want to consult your doctor or your medical practitioner to see if there's a better dosing than that high a level. Is that safe to say?
Right. So, the Rick Simpson oil, that's RSO Rick Simpson oil. Rick Simpson was a person, and his protocol, it was kind of one of the first things to go viral on the internet. And it was, his regimen was the gram a day.
Right.
And it wasn't all in one dose. It was, and it took time, so starting with a half a grain of rice,
Sure.
3 times a day and gradually increasing. But there have been some studies looking, and these are test tube cancer studies, not human studies. But some of the anti-cancer properties with THC depends on the THC actively being in that receptor. And so when they've looked at it, it's the consistency of dosing is more important than the actual total dose. So I have not seen many people that can tolerate, 850. And I think the reason they're asking about 1,000 milligrams, it's 1 gram of FICO, and it's usually about 85%. So the 850 milligrams of THC in a 1 gram syringe but it wasn't so much important as getting the whole syringe in daily. It was being able to tolerate a consistent, 3 to 4 times a day dose,
Sure.
keep the THC in the receptors. Because when the THC wasn't, so basically, and I'm sorry, I'm blanking on the cancer type it was, but it was basically when the THC was sitting in the receptor, the cancer cell couldn't divide.
Right.
But when the dose wears off, then the THC is not there and the cancer cell resumed dosing. So
Sure.
again, I don't tell anyone to use THC as a solo method. I may use all the tools in the shed, positive thinking,
Sure.
meditation. If I tend to tell patients it's more like, let's work on, your nausea, your pain, your sleep while you're going through your cancer treatment. And let's think of any anti-cancer side effects as a good side effect instead of a bad side effect.
Right. And
If your
and
cancer cells are
RSO is
less
extremely strong. I mean, it's
correct.
probably I call it the 151 Bacardi of cannabis. So not only is there a lot of it, it's a very strong product. So I'd say be very, very careful when you're taking it. That's
Correct.
it.
And yeah, don't start with a syringe in one 24-hour period as a naive,
No.
like we would still want you starting at the 2.5 milligram dose and work your way up.
Yeah.
Yeah.
It's a marathon, not a sprint.
Amy had some comments.
I don't think I have anything to add beyond what Dr. Beasley said. RSO is always going to be one of the strongest products you can get.
Mhm.
It can be extremely effective, but it is extremely strong, and I wouldn't recommend it for new patients just starting out. I generally only recommend it if they find that they're not getting relief with any lower strength products.
Right. Yeah, and I should also point out RSO is also a whole plant product. So you're getting all the terpenes with it as well. So you don't have to worry about what is your terpene profile. I mean, that's one of the things I love about RSO is it really is a complete solution when you're looking at addressing a particular condition. It's really there. So good form. Let's jump into the next question, and that is that are edibles from the dispensary different from something I can make at home? Why are edibles always sugary? That's a good question. I guess Emily or Marley, you want to start with this one?
I'll go with this one. We get a lot of questions about this. Unfortunately, Florida is not the most up to date of, the market. So we are limited. We do have the typical edibles, candy gummies, stuff like that. That's what people are used to. We get a lot of requests for sugar-free, gluten-free type of products. We're just not there yet in
Mhm.
Florida, I would say. We're barely getting there. We're getting there. Um, you don't have to have a sugary. I'm not a sugar person at myself, but I've eaten
Sure.
even cannabis infused cornbread, which is crazy.
Mhm.
But you can purchase different type of products like FSO or distillate syringes. You can make your own edibles. You don't have to um, process the cannabis like the old school way. A lot of people did the flour to turn into the butter machine and all that and have to do all that. We have which you can still do if you'd like, but we do have distillate, which you can add directly to your batter or whatever you're making.
Sure.
And you can create your own edibles with that. I've also heard of so many people making like adding tincture oil or distillate oil or FSO to their like olive oil, making their own salad dressings. That's not a sugary type of product. You can experiment with it, look up recipes. I always say go to the internet because they have everything.
I should also point out that when you asked is there a difference, I started making, I call them magic brownies. It's what I make at night to help me sleep. And I started with RSO oil. I use the syringe. I use ground flour now. And the reason for that is because I learned an important lesson about making it myself, and that is pay attention to the dose. Because the first batch of brownies that I made, I used a whole syringe of RSO, and I have to tell you, they were potent. I know we had to be very, very careful in using it. It was really important. So pay attention to how much you're putting in there and the dosing that you're using. I know that because otherwise you make them so strong that it's really hard to figure out what the dosing and right thing is to do. So the
Yeah.
answer is yes, you can control the strength, let's put it that way. It's one of the things, as well as the flavor, like putting in, like when I make my brownies, I like almonds. Okay, so we get a little bit of almonds in there. It's something I may not find in a dispensary. I'm not knocking the dispensary. I'm just saying I'm kind of tailoring it to my own taste, which is nice. It's there. But I have to mix those brownies. You have to mix it quite a bit. My wife is a cook and she helps me get that right. Let's put it that way.
I
So
believe the future will be gluten-free, sugar-free type products that are
mhm.
comfortable for everyone because that's the main question I get is the milligrams of sugar. Why is there sugar? You're only taking a
Sure.
small amount, but still it's a concern, especially for people that are diabetic and have other
Yeah.
issues.
Yeah, that's a good point.
I
That's a
think
good
it's,
point.
a lot of novices don't like the cannabis taste, like they complain about the grassy taste. So I think the sugar, just like children's medicines, like,
Yeah.
great flavor, Dimetap, that kind of thing. One thing I wanted to add is anything you make at home has to stay at home. Remember, you're required to carry your products in the original packaging. So if you buy RSO to cook with it and you put it in a brownie, you now have no label. How does that law enforcement officer know you didn't buy it off the street?
Sure.
So anything homemade stays at home. There can also be less shelf life. So I've had people upset, where they buy a whole syringe of distillate or RSO, make their gummies, and then they mold in a few days, just as we live in Florida and it's humid. And then you say, well, keep them in their freezer or the refrigerator. But if there's children in the home that might get in, they're not in childproof packaging. So that's the caveat to be careful with it. The other advice I give patients when they want to make their own homemade stuff is do a test run. So make your
Yeah.
brownie recipe, cut it into pieces, figure out how many pieces you're going to get, and then we're happy to help them do the math. And I'm sure Amy's office would do the same thing.
Sure.
So you got 40 pieces of brownies and you want them 10 milligrams a piece. That's going to be about 400 milligrams of THC. So you need
Sure.
about half a syringe. And make sure you mix it well and do not lick your hands when you're cooking. A lot of people, as they're mixing, I've had patients tell me they took a really good nap because they didn't think about it, tasting along the
Yeah.
way. So
I would also mention that a lot of people have tried homemade edibles before they've ever had any type of edible from a medical dispensary that's dosed. And that's a scary thing. I've also experienced that myself where you're like, I'm very scared of taking edibles because I've tried an edible like from somewhere that might be off market or I didn't know the dosage. That's one great thing about getting the edibles from the dispensary. You know exactly how many milligrams are in each of those
Good
edibles.
point. Yeah.
When you're taking a homemade edible, you might not know how many milligrams they put. It could be a massive amount. It could be, so that's a misconception too. All edibles make me over the top. Well, you might have taken an edible that was a 50 milligram edible and you could take a 5. It
Right.
can be controllable and dosable. And that's what the great thing about getting it from a dispensary and getting it from a well-known source where you know exactly what you're taking is exactly what it is.
Sure. Yeah, that's a good point. Figuring out the right dosage that it really is there. I do want to say also, you brought up something earlier about if you have brownies, for example, put them away, keep them out of the way of children and candidly animals. Okay. I made a batch of brownies for my mother when I was in California, though she was going to try, and we put them on the table. We went into the front room to get something, and the dog went and ate them. So the dog was out for 2 days. Seriously, I thought we were going to lose him, but it was only like 2 minutes that we walked away to go get something in the front room. And I'm sure that you want to really pay attention to putting those things away and really protecting them. I think that's really, really important to pay attention to. That's really there.
dogs have more cannabinoid receptors than humans. They're actually more sensitive.
Mhm.
And
No.
and can
Yeah.
have seizures. So that the recreational states, the veterinarians have had a lot more care with the people dropping an edible on the sidewalk, and then they're
Sure.
walking their dog and didn't even know that they had ingested it.
Yeah. Good
Just
point.
as dogs pick up stuff.
Yeah, no, you have to be very, 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 very careful. I mean, you have a fur kid, you have a pet, something that's really part of your family. You don't want to do anything that's going to put them in jeopardy. Like I
One
said,
last, yeah, I'm sorry, Mark.
Go
I just had
ahead.
one other thought with the edibles is people need to remember you get 4 times better absorption with food in your stomach. So
Mhm.
what you're saying, Marley, about the edibles being consistent from the dispensary, I still hear a lot of people say, well, I tried this one gummy and it wasn't very strong. And then the next one out of the package was so much stronger. The variable is if they'd eaten food or not, so
Mhm.
you're trying to be healthy, you eat dinner at 5 or 6, you take your gummy at 9 or 10, it doesn't feel very strong. But you go out to dinner, you eat a big ribeye, you have a glass of wine, you came home and take that same 10 milligram edible, and
Yeah,
you think it's the store's fault because it was mislabeled. That one had to be stronger, but it's really
sure.
your gut.
Yeah.
So
Just
I
like drinking on an empty stomach. I didn't mean to interrupt you,
yeah.
but I actually have a question about that because a lot of people, I've heard that, the the absorption of the cannabis, absorbs better with fat. So like peanut butter or something. That's why I feel like the chocolate works for me because of the fat content in it. Do you believe that's correct too. Is that the same type of aspect with that?
Yeah, so we actually the studies, because Epidiolex, the crystallized CBD had to go through all these pharmacokinetic, pharmacodynamic studies to get FDA approved. And a lot of those kids were G-tube fed, so they, because they had severe seizure disorders, so they knew what they were getting. And that's where the 4 times better absorption with food comes from. And so THC is a very polar molecule, and so is water. So they naturally repel each other. You eat food, it turns on your digestive enzymes. So your pancreas, your gallbladder releases those enzymes in response to the fatty food, which then helps get the THC across the gut wall. So that's why the fatty food helps. Is it's just turning on your pancreas, and it doesn't have to be a huge meal. Like you said, a spoonful of peanut butter. I had one patient, we were doing telemedicine, and I was telling him he needed food, and he's like, "So you're telling me I can have ice cream at bedtime?" And his wife was in the background and did this total side eye. I was like, "It can be avocado, nuts."
Yes, I am
full-fat
telling
milk.
you can have ice cream.
Yes.
I'm telling you from a non-professional aspect, have that ice cream.
Yes. So just it can be healthy fat, but you'll get more bang from the buck from fats versus carbs, because you get those it's particularly the pancreatic enzymes.
That's interesting. I love all the information you're giving. Thank you so much.
Yeah.
That's really,
yeah,
really
it's
informative
great.
there. Cool. Let's run to the next question. I think, Amy, maybe you can help me with this one. Can veterans and first responders use medical cannabis?
Yeah, absolutely. So as most people know, I am a disabled veteran, and I do get all of my health care through the VA, so I'm very familiar with most of their processes. I do always recommend that all patients in the VA that are using medical cannabis talk to their VA doctor about using it, because it is another medication that they're using. And so the VA doctor should be aware of all of the medications that you're using, including medical cannabis. So it's super important to talk to your doctor about it. That being said, the VA cannot recommend medical cannabis. They're not really going to talk to you about it. They acknowledge that it exists, but because of what Dr. Beasley was talking about with the Schedule 1 and Schedule 3, they are a federal agency, and they will not touch cannabis with a 10-foot stick because it is still Schedule 1. So yes, veterans can use it. They can still receive their health care. It's not going to affect their benefits. It's not going to affect their disability or anything. But just talk to your doctor and be open and honest with them about using it, so that they have a full picture of all the medications that you're using. And then for the first responders part, it's going to depend, are you actively working as a first responder, or are you retired? Retired, you're kind of in the same boat as a veteran. Nobody would necessarily know unless you told them. However, if you're still actively working and you hold a professional license, whether it be EMT, paramedic, or you have your standards for fighter, you are generally going to be subject to both local and state laws concerning your employment. And a lot of times cannabis is not considered okay for most people that carry a professional license. There was a case in 2024 that it was an EMT that had been fired by his department for using medical cannabis on his off time. And that was the big part. It was during his off time. The courts did side with him and said, yes, he should be able to use this because it is recommended by his doctor. He's using it during his off time, and it's not affecting his work. Well, the courts did side with the EMT. It did actually not provide any workplace protections. And the big thing that a lot of people run into is employment drug screenings. And if it's not employment drug screenings, then it is workers' compensation drug screenings. And there are no workplace protections except for in Massachusetts. So Florida is not there yet. And so unfortunately, there are no workplace protections that includes for first responders and other people that hold professional licenses. This also includes truck drivers. If you have a CDL, that is a federal certification that you have to get every year for your DOT physical. That is federal. And so if you have a CDL, you really should not be using cannabis products because you could be in violation of the license that you hold. So
good point.
Yeah.
That's a good point.
That's where we are.
Good. Well, thank you. Yes, I think that's important. I think hopefully as more research comes out, it'll help clarify this question as well for the politicians, so that we have a guideline. Let's put it that way. I think like anybody else, if you're, if you're running a forklift, you don't want to be drinking. It's the same thing with cannabis. You don't want to be, you got to pay attention to the job that you have because you want to really be safe. It's really out there. Let's look at the next question, and that's what's the most effective route for treating arthritis and medical cannabis? Dr. Beasley, you want to take this one?
So this is where I love the one-to-ones, the half CBD, half THC, because the CBD is kind of hitting the anti-inflammatory side. The THC is better for nerve pain. So those are always my go-to. Of the Surterra products, usually the one called Soothe. It's a hybrid that leans towards the indica. And then this is where the topicals really, I would. The fixed balm at Surterra, I think has a cult following. It's a one-to-one, good bit of menthol in it. And again, hands, feet, and knees. I think it works well. The topicals, the limit of the lotions, creams, balms is depth of absorption. So, getting to the disc of your back, just the absorption isn't there. But if it's a tight trap muscle because of the disc in your back or your neck, then it can help. But I think, hand arthritis, knee pain, those are great for, but if I just had to say one product, a one-to-one, so that you're getting the THC for the nerve pain because those nerves are irritated by all those little bone spurs, and then the CBD for the more anti-inflammatory side.
Yeah, I think you brought up a good point. It's and not just not a one-trick pony. I mean, topicals were great. The one-to-one, the tinctures were great, but in combination they work even better. What I'm trying to point out, because you'll get at 4 hours to 6 hours off a tincture, where you only get maybe an hour or two off of a tincture, a lotion or a cream or a gel or something like that. That's really there.
The other thing to remember is topicals aren't psychoactive at all because they're not absorbing into your bloodstream.
Right.
So, hand arthritis, driving the steering wheel, you can have topicals on and it's not going to impair you in any way.
Right.
So it's, a layered approach. Soothe, I didn't say Soothe is available. It can be tincture or Theragels or vape pens. And most dispensaries have a one-to-one. But the CBD THC combination is great for the arthritis.
Sure. Great point. Next question, which is a great question, is what products or stores would you recommend for medical grade pure CBD products? Can I buy CBD with absolutely zero THC? Anybody want to take that one? I have some answers. But anybody want to try that one? I like to take it if possible.
Go ahead.
Okay. First of all, when you say medical grade, what I want to see is a certificate of analysis that looks exactly like the COA that we get with medical cannabis. I want to know what's in it. I want to know the cannabinoids. I want to know the terpenes. I want to know if there's any mold, pesticides. In other words, I want a full, thorough COA to tell me that it is a product that has been tested. That's my definition of medical grade, is that you have that bar that's there. Now I have to tell you, I did a webinar on CBD, and I've just finished a reel on CBD for pets, for example. And what we found is, out of the 12 different products that I look for, only 2 of them I would consider to be medical grade. The rest of them, when I went to my head shops and things like that, did they have a COA? Yeah. It didn't tell me what's in it. It told me it had CBD. That was it. Didn't tell me about the terpenes. Didn't tell me about if it had mold and pesticides. And candidly, some of those COAs were a year old. So I know it wasn't the batch that I'm buying doesn't match this particular COA. So the answer is it's very hard. There is no regulations in the CBD market for testing. It's kind of a wild west. Now, that being said, there are companies like SunMed, that's actually here in Florida, that do put out medical grade COAs and that do a really, really good job. I know that there is Dr. Barry Gordon has just introduced a line of CBD products, and he has CBD. He has the complete medical grade that's really out there. Those are the 2 brands here in Florida that I know of. There are others that are being put out in other states, but I think here those are the 2 that I would really recommend to take a look at. That's the medical grade that I've seen. I've not seen any. I know that now that's different from in the dispensaries themselves. You have CBD products, but I think your CBD products mainly are ratioed that have a certain amount of THC in it. And when you're looking at CBD products, you have what they call isolates, which is cannabinoids by themselves. You have broad spectrum, which has just the terpenes and the CBD by itself. Then you have full spectrum that has the terpenes, the flavonoids, the cannabinoids, and also 0.3 or less THC. So the answer is, if you're looking at buying a zero, absolutely zero, you can't say absolutely zero. It's pretty close to zero. I think the broad spectrum product would probably fit in that, or if not the isolates. Amy, your thoughts on this? Because there's different kinds of CBDs to look at. And you
Yeah,
run
so
a
as
discussion
far
on
as
that.
I understand it, you would like an isolate would be just like you said, it would be just plain CBD all on its own.
Yeah.
Something broad spectrum might be a little bit more beneficial, and then the full spectrum is going to have up to the 0.3% THC by weight. So anything that is full spectrum always has the chance of having THC in it. And I would honestly say unless you get a COA, there is always a chance that any CBD product could have
Right.
THC in it.
Right. And that's the biggest issue, I think, with my issue with CBD products is getting a legitimate COA. I mean, the COAs that are out there aren't worth the paper they're printed on for most of the CBD products, and that's why I tend to stay away from those. The gas station ones and a lot of the store product, the ones you find in these head shops, I'd just be very, very careful. I don't know. You guys any comments on this, or that's kind of
Right.
my
So
opinion.
the Florida statute, the low THC products we have in our statute that y'all have, the Florida medical definition is less than 0.8% THC. So a hemp product is less than 0.3%. So the Florida low CBD, low THC products have slightly more. And I guess whoever's asking the question, it kind of depends on, if they need zero for their workplace,
Right.
the hemp market would probably be better for that, for getting those isolate, because the Florida statute standard is 0.8%.
Right.
Medically, 0.8% probably doesn't, isn't going to be, I mean, you'd have to probably down, I don't know, a couple bottles of Tranquil to even feel any
Sure.
THC. It's an 18-to-1 ratio, CBD to THC. But on the hemp market, so part of the difference with those, the lab testing is, remember, hemp is done under Department of Agriculture, medical cannabis is done under Department of Health, and Department of Agriculture never really signed up to be the police of psychoactive drugs. They kind of got here, they thought they were going to be doing hemp as a fiber product, for making clothes and
Making
sails
flows and
for
ropes and
ships
all those
and
kind of
rope.
good things. Yeah.
Textile. Yeah.
The CBD market kind of surprised them, and then the gas station head shop stuff that should be reeled in this coming November because of the Farm Bill loophole. Some of those will be going away, but I agree there are reputable purveyors, but you need those COAs and make sure they haven't just been
Right.
copied pasted, because Department of Agriculture they're trying, but they did not sign up for this job. They're farmers, not medicine.
Right. That's a good point. And again, I'd stick to the SunMeds or Dr. Barry Gordon's called Physician's Choice. You can look them up online, and those are the ones I'd really recommend. I'm sure there's others. I just don't know about them. Let's put it that way. Next question is I was granted the exemption and was allowed my initial increase. Is there a way I can increase my allowed amount beyond 6 ounces? Maybe Amy or Dr. Beasley, you can address that one.
Yeah, so this is talking about the request for exemption. So it's our Florida statute. And so he or she's talking about flour. So the normal statute limit is 2.5 ounces in any 35-day period. I think it was 2023, we got the ability to ask the state, Mother, can I get an increase for this patient?
Sure.
A lot of doctors don't do these at all, because when this came out, Department of Health said, hey, doctors, if you're doing crazy stuff, not only will we take away your ability to prescribe cannabis, we will take your whole medical license away. They were very draconian about it. So like I'm in the Panhandle, so the 4 Panhandle counties. I have 3 employed doctors, and I'm the only one that will do RFEs at all. Like my 3 employees, we give physicians choice. We're not going to make anyone do anything because it's their license,
Sure.
not make them do it. My personal policy, which is complicated math wise, but it works for me. I only let people do exchanges. So I figured out, 25% THC flower, an ounce of flour is worth 200 milligrams of THC in 70 days. So it's basically 200 milligrams, because the way Florida works, we have the process routes, the vape pens, the edibles, and then we have the flour. So if I go up in someone's flour, I go down on their process routes, because most people have a favorite route. My personal limit is only 4 ounces. And I did that because marijuana trafficking federally is 4 ounces. So I did not want to be involved with a trafficking charge federally because I was facilitating someone having more than 4 ounces possession. So that is Shelley Beasley personally. That is not Florida statute. Um, when you ask for more, that physician is drawing attention to themselves. We're going to be reviewed by DOH. They want to see, why are we asking? You actually have to provide more medical records if you go higher levels. With my 4 ounce limit, I've never had to ask, supply the state with more medical records.
Cool.
But if you get above those, it can. A lot of times it's education. A lot of patients don't understand the rolling 35-day limit, which I call jail. So, whatever day you go make a purchase, that amount you purchased goes to jail for 35 days from that date. So you can't shop on the third. A lot of people get their disability checks and they want to shop on the third of the month. You can't go every month on the third because you have to wait 35 days. Or you shop a big Memorial Day sale, everything's still in jail for the 4th of July sale because Memorial Day and 4th of July aren't 35 days apart. So what I find most of the time is once I educate a patient, this is how it works. This is how you log into the registry, check your balances. Because sometimes they're leaving some on the table. When I go back and looked at the 7-month history, I'm like, hey, this time, you had 4 ounces, but you only bought 1.5 ounces.
Right.
Because they didn't remember to go back after 35 days. So most of the time, education, like I said, I've been doing this 10 years. I've been doing RFEs, I guess almost 3 years at this point. And I've had very few people complain about the 4 ounce limit.
Good point. Good point.
I would say I just want to jump in on this. This is a constant issue. Unfortunately, the state segregates smokable flower from every other form of cannabis. So everything else is judged by milligrams and the flower is judged by weight. So that's the first thing. And we try to describe or explain to people. And like when you're smoking flower, we talked about already, it's an immediate effect, but it's not a long lasting effect. So you can go through, if you're only using flower, you're going to be going through a lot more than if you were taking edibles or concentrates and other type of products. This is a constant problem. With Surterra, I try to show people how to look at their own state registry because that's something that's not expressed to by a lot of doctors. And Dr. Beasley, I think I would recommend anybody to you. You are so knowledgeable, and the way that you've been able to describe things, I don't hear people coming to me from that know that their doctors. I'm like, have you spoken to your doctor about this? Have you asked about how to check these things? So I try to go to lead them to show where they can check their own state registry. They can see where their prescription limits are. They can see where they are with their purchases. We tell them when they can purchase more. If like we said, the effect of smoking wears off fast. So if you're running out of flour a lot, which I'm a flour person, so that's my main use. I have that same issue. Try to compensate with maybe something like an edible or tincture or something else that would maybe alleviate some of or last longer in your system so that you don't have to use just the flour for your only source. But it is a very high level of frustration for people when they don't understand that issue and that situation. And it's just the way that the state segregates everything.
There's another way of looking at this too, and I'm going to bring up dry herb vaporizers. And the reason I do that is because I think, Dr. Beasley, you pointed out earlier that when you have a joint, and you take that 550-degree lighter or that 800-degree lighter and you put it up to the joint, you're burning off a lot of the cannabinoids, a lot of the terpenes, a lot of the flavonoids. You're decreasing the medical efficacy of that joint, probably 50 or 60%, for example. That's the bad news. Good news is it still works. The problem is you need to take more of it. So one of the things is you can increase the amount of cannabis that you're buying if you're taking it that way. But if you use a dry herb vaporizer, what you're able to do is you're able to set the exact temperature. Like in my case, I set it at 356 degrees, and I'm using less cannabis and candidly getting more medication for my particular condition. And that might be an option as well, is not necessarily burning it up, but putting it into a dry herb vaporizing it and making it a more efficient way of taking it. That's another way of looking at it. That's all. It's there. So again, I'm a big dry herb vaporizer fan. That's there. Let's look at the next question, which is, what is the best vehicle for pain without high? Is it topicals, tinctures, etc.? Amy, this falls kind of in your category.
Yeah, I would actually agree with what Dr. Beasley said earlier. I think it's a multi-layered approach. You have the way I kind of explain it is if they're familiar with pain management at all, generally you're going to have a longer acting medication that is going to cover your pain for a long period of time. And then you might have a shorter acting but quicker acting medication that helps you get over those humps. And so for patients with pain, we're not trying to chase the pain all day.
Mhm.
The way that I would usually recommend it is if a patient wakes up in the morning and they have pain, they might take a dose of something like an edible. But because we know the edible is going to take 45 minutes to an hour and a half to take effect, they might also take a small dose from a vape.
Mhm.
And the point being that they're getting their pain under control quickly with the vape, but we know the vape isn't going to last very long. So as the vape is coming down, the edible is coming up, and we're
Correct.
keeping the pain control consistent throughout the day. So
Mhm.
I don't necessarily think it is always going to be a one product solution. Um, I am always for trying multiple products and seeing what you can combine together to get the most comprehensive relief for the longest period of time without chasing your pain.
Sure. That's a good point. And one of the things I'd like to point out is maybe Dr. Beasley, you can comment about patches, because I think patches work very good for microdosing and helping people throughout the day. I know that there are some patches you can buy that last 72 hours. So that's something that might help rather than trying to hit a vape pen in the morning. You might want to try a patch. Your thoughts on that?
Right, it's long, like I said, like that low flat road, and if you had breakthrough pain, you could add a vape
Right.
on top of it.
Right.
The caveat I will say with patches in Florida in the summer is people tend to sweat them off, and it's a higher price point product.
Sure.
I've had day laborers, people with back pain that dig ditches, and they're frustrated that it doesn't stay on, just
Good
you
point.
sweat. So you kind of have to pick your, winter time's easier, or once you get home.
Right.
When you're, because who's not sweating this time of year in Florida? So,
Sure.
um,
But I
it's,
think it goes
that
back
might
to
be
layered approach. I think you're right. The layered approach, Amy and Dr. Beasley brought it up. The layered approach really makes a lot of sense. I don't think there's a one-trick pony
right.
when it comes to managing pain. Because like in my case, I have herniated discs in my neck. I'm a senior citizen. I got two artificial knees. I have pain 24 hours a day. It's not a matter of do I have it in the morning or do I have it in the afternoon. I've got to have a regime that wakes me when I wake up in the morning. What am I doing midday? What am I doing in the evening? What am I doing for sleep? I think that's important. That goes back to the layering that you were pointing out earlier, is really coming up with a product that really helps quite a bit.
Right. And Surterra, I really like the Serene for daytime. Like if
Mhm.
the patches are sweating off, like the 5-to-1 ratio.
Yeah.
So 5 part CBD to 1 part THC. I have a lot of people who can, what the law says is we don't drive impaired, but, try
Right.
it at home first. I have patients who are able to use Serene, work, drive, get back home, so at nighttime they might use the 1-to-1 or the 1-to-9, but
Mhm.
daytime might be the 5-to-1. So tell patients, how do I feel and what do I have to do today? If you're
Yeah.
picking up grandkids from school, you might only use a CBD product or
Right.
not take anything. But you got the Christmas decorations down and your back's hurting, or your day one after chemo and you feel crappy anyway, use the high THC product and stay in the recliner.
Right.
It's, in the big scheme of things, you're going to better to be a little high, a little sleepy than to be in pain.
And the
Um,
nice part about cannabis is you have options.
correct.
You can choose those options that are there. That's really helpful. It's there. So let's jump into some of the live questions that have been asked. I think we have like 3 or 4 more questions. How do you find someone like these wonderful ladies to help you determine what will work best for you? At my local dispensary, it's local dispensary. It's always a bunch of young adults who could care less and are always in a hurry. I should say, I think Marley, this falls right in. You run a dispensary. What's your thoughts on this?
Yes. So I've been with Surterra for 6 years, and I would say something that sets our company apart is the knowledge and education, and that the employees and the bud tenders, the managers, the leads, they've worked in the cannabis industry longer than me, some of them in California, other states. We all collectively come together to answer questions and to find the best answers and solutions for our patients. I have experienced some in other dispensaries where people are not as interested in maybe involving themselves in your need or conversation. I can't
Mhm.
speak for those other companies. I can speak for our company, and that is what we're here to do, is to help you find your products. I know that if you come to our stores and you present questions, we will be there to guide you as much as you would like to.
Mhm.
We
You
are
know,
not in a
it's
hurry,
interesting.
but if you're in a hurry, we can get that transaction done fast. But we're there to meet you at whatever level you're at.
Mhm. You know, you brought up an interesting point. All dispensaries have to provide consultation as part of their charter, and they do. But it's like any chef. You know, you have restaurants in town. Some chefs are great, and some chefs aren't. Some people know what they're doing. Some people don't. And I found that I've talked to, you know, I know I live in Claremont, and I've talked to most of the dispensaries in here, and I can tell you there's a few that are very educated, and there's a few that I wouldn't. You know,
I
they're just it's a matter of, it's like the chef.
I
Some
do
are
want
there,
to
some aren't.
speak to the education that's coming out now. I actually had a lead bud tender who was 21 years of old, and he went to Florida Gulf Coast University and
Mhm.
took cannabis courses, and he was super educated and knowledgeable and very mature and able to communicate those
Sure.
things. So don't judge a book by its cover, but I totally understand. Come to Surterra,
Yeah. Yeah.
Right, I was
That's
just
what
say
I'm saying.
same thing. Like they can be young, but knowledgeable.
Mhm.
especially now that the college courses, I
Yes,
when I was in college, that was not available. So when I heard about the things that are offered in our state at it, like I said, Florida Gulf Coast,
yeah,
for one example, I was like, I want to go back and take those classes now because that's going to be where we all need to be.
right.
Yeah.
Yeah,
I know that
LeapCom has one as well. So that's good.
Awesome.
The other thing I would
we,
mention is you can kind of pick your time, so if you go in on 4th of July when everything's 50% off, it's a business. They're going to have more customers. It's harder to
mhm,
take time. I'm a big fan of Sunday afternoons. It tends to be slower pace. There's
sure.
more time to talk. So you kind of pick, same thing, I'll do the early bird special at a popular restaurant so I can get the table. You can
Sure.
do the same thing. And if it is busy, I think y'all take appointments too, right? So
Absolutely.
you can schedule.
Call and schedule. And yes, like don't obviously if we're having a super busy holiday or something like the day before Christmas, not necessarily first day to come and try to learn everything about that you need to know about cannabis. But if you come in, we're busy, we could reschedule, whatever works for you. We're here.
Sure.
And we want to teach, we want to learn.
And the other thing is don't forget your doctor's offices. I'll talk about MMTC. We are not the cheapest place you can get certified, but we do work on customer service and being available. We're not renting a hotel ballroom and certifying 300 people. Um,
Right.
we are here to do the education and we are here full time. Amy's there. I have a full time LPN. So questions are free. Like, our appointment price is not the cheapest, but if you call us weekly, every 2 weeks, hey, I tried this, this didn't work. What else should I try? Those are all free consultations. Or if you need an extra appointment with me, we don't charge for that.
Right.
So, kind of look at where you're getting don't forget about the doctor's office as a source for information.
The
And that's
doctor
an
is the
excellent point.
first point of when I sometimes I get questions where, we are to our best ability able to offer products and help you match you up with the products, but we are not medical doctors as Dr. Beasley or the nurse Amy. Like those are the people you need to go to first. Those are the
Right.
people that you got your prescription from, just like you would any other prescription. So if you have questions about how they interact with any other type of prescriptions that you're taking or stuff
Mhm.
like that, those are the first people to ask. The one that you're getting the prescriptions from.
Definitely.
Let them
That's a
know
good
what
point.
other prescriptions that you're taking as well and see how the interactions of the drugs.
But there,
Yeah.
Absolutely.
yeah,
And
people in Florida going and getting certified in a parking lot, a free event. There's no room for education. Where are you learning? Where do you find out
Mhm.
about your medical history? So again, cheapest is not always the best.
Yep,
So
absolutely.
Because it's not a matter of getting your card. a lot of people go to these events, get their card. The question is, what do you do with it afterwards?
Right.
Do you have the support? And this is where the doctors come into play, like Nurse Amy and yourself, the Dr. Beasley. The support is probably more critical than the appointment itself.
Absolutely.
Because this is where it's a completely new area. It's well out of your wheelhouse. And if you can have somebody you can rely on to help you guide you, especially a professional, that makes a big difference. And I think that's really, really key. It's not just the price of getting the card. It's the price of, do you have an environment that can help you get the most out of your cannabis from an efficacy standpoint and from a cost standpoint. I think it really helps a lot with that. So it's a good point, Dr. Beasley. That's really there. Next question is, I take Plavix and aspirin, have been told my CBD/THC tincture will make my Plavix less effective because both use the same receptors to be metabolized. Dr. Beasley, do you want to take this one?
Yeah, so cannabis luckily doesn't, there's a lot of test tube interactions. So the liver, it's the liver enzyme pathway. So it's, I never remember which one, CYP2C1, whatever. So it's like the crowded door phenomenon. So, if your liver, if your cannabis is in the doorway, the Plavix can't get out or the Coumadin can't get out. So a lot of these are test tube level findings, but in an actual human patient, there are not a lot of significant interaction. So, I'm not this person's doctor. I can't tell them it's 100%. But while we've been sitting here, uptodate.com is a very common website. The physicians, we pay to be members of it, and you can look up drug-drug interaction. So I actually put in cannabis and Plavix, and it came back, level A, meaning no significant interaction. So, if this person's family practice doctor used UpToDate to look it up, it comes up there's not. So, Coumadin, which is the old school blood thinner, it's rat poison, warfarin. There were some case reports of that, and it was more. And now we have better drugs, so we don't use the Coumadin as much. But it was more of the recreational Saturday night smoker. So, when you used your Coumadin on Saturday night for fun, it blocked up and your blood got too thin. But if you adjusted the Coumadin dose down for during the week and you weren't smoking then your blood could get too thick and then you could have the clotting complications.
Right.
Coumadin is just a sloppy drug, but this person definitely needs to check with their physician. But like I said, I looked it up on uptodate.com, and they don't see it as a significant interaction for that. But if they were going to use it, you might have to do more frequent, platelet counts, bleeding time test with the physician just to make sure everything's stable.
Good point. That's a good point. Last question comes into play. It might be more of a comment than a question, but it says, when medical research takes off in the United States, hopefully, will something like a breathalyzer/alcohol type device be developed for THC CBD so folks won't go to jail after for driving a month after using a THC product? Well, let me. This has really got two dimensions to it. Is a device like this going to be developed? I think they've been trying to develop something like this for a while. Is that correct? I mean, Amy and Marcel, they've been trying to do this. I don't know how effective they are, but I know they've been trying to do it.
Right. No, for a while. So the problem is THC stores in fatty tissue. So it doesn't clear like alcohol does. Hours after alcohol, what is it? 1 drink an hour, your liver can clear it. Cannabis stores in the fatty tissue. That does not mean you're impaired. So like what the person asked in question, it can be a month later, and especially if you have a higher BMI, it can stick around. So we don't have any tests that correlate with impairment. And that goes back to the CDL thing Amy was talking about. If we had a test that could show, hey, this CDL driver, even though he used his cannabis over the weekend, on Monday morning, his test is negative, he is okay to drive. That's the other issue with first responders, is just they're driving the fire trucks and the ambulances.
Right.
It goes back to the CDL issue. So for a while, I think Michigan was looking at saliva testing because they're a recreational state. But I think it's now going back to like a breathalyzer type. So I would love to be the person to develop it because they are going to be in the bank. Once we get something reliable, because that's really the holdup, is how do you prove someone's not impaired? A nurse coming on their shift, a worker's comp, there's an accident at work, you go blow into your cannabis breathalyzer and prove that your level was 0 at the time of the accident. We know cannabis wasn't a factor. So we definitely need it, but I don't think it's so much the schedule change because, Israel, Portugal, they've all been doing research. Like Dr. Moshulam's lab, since the 60s. But the problem is it stores in the fatty tissue and finding a body fluid that correlates because urine and blood does not. It sticks around, up to 4 to 6 weeks in people with chronic use and higher BMIs.
Mm-hmm. Yeah, I think that's a good. I think you made a good point. It's not a schedule issue. This is a demand issue, and I think there's a lot of demand, especially by the the law enforcement profession, the legal professions. A lot of corporations just want to be able to see this. I think there's some demand for it, but without the research, you're not going to get it. And I think a lot of the research being done overseas is being done, but it's not. I don't think they have the urgency that I think we see here in the United States, or maybe they do have the urgency. I don't know, but we just haven't seen it. It is something that is a high demand product. And I think you brought up a point. The person who develops that's going to take it to the bank. That's for sure. So hopefully the demand creates supply. Okay. So hopefully we'll see if that all comes into play. I think that the other comment I want to make is now being able to open up to medical research is going to be, I think, a big boon because the United States is known for doing a tremendous amount of medical research, and we just haven't done any. And I think this is where a lot of questions are going to be answered over the next 10 years. It's not going to be something over the next year or two. It's going to take a while to get that medical research engine going, but hopefully we'll see a lot of things happening in the future. And I'm kind of hopeful. That's the one thing I hope comes out of these things. But as we said earlier, where's the beef? Where's the laws and the organizations and the hearings? We just kind of got to go through that process to put it all together at this point in time. So cool. Well, listen, we've answered all of the questions that were brought. First of all, I want to thank everyone who's tuned into this webinar. I've noticed that the people tuned in are still here, and it's been 2 hours. So I want to thank everybody for watching and sticking with us. Hopefully you got something out of this and it's been informative for you that's really there. I think I'd like to get your final comments. Each of you, Marley, let's start with you. What's your thoughts and give me some final comments.
This was super informative. I really appreciate having the medical professionals on to answer some of those more difficult questions that I even have myself. I love the collaboration, and I'm here to support and help in any way we can.
Great. Thank you. Emily?
I just have to say, similar to what Marley just mentioned, Dr. Beasley and Nurse Amy, you're both incredible. Marley, you're a complete superstar. I just feel like, Mark, every time that I'm on one of these webinars, it is so great to be able to learn something new and be able to share that with everyone out there, because as we talked about, we just don't have the education that we'd like to be able to have, and to be able to bring experts like this together is really incredible what ends up producing from it. So thank you so much for having us and doing this.
Okay, well, thank you. Dr. Beasley, your comments.
Yes, thanks for having me. I love geeking out on this stuff. It's fun. And even though Amy and I work for the same company, I've never seen her in person. We practice chat on our EMR regularly, but so this is nice to put a face with the chat box. And I love, seeing the Surterra. I wasn't aware about the new CBN, CBD, THC combination product, so I've learned as well. So I appreciate, Mark, you putting us all together.
Thank you. Amy, your thoughts?
Just thank you so much for having me. Just like everybody else, I definitely know I've learned something tonight, and I definitely appreciate that. I just appreciate you all taking the time to be here. So thank you.
Yeah. Well, first of all, I want to thank our speakers tonight. I know it's been 2 hours of your personal time, so thank you. But it's been very collaborative. At least I learned a lot tonight, and I want to thank you for that. I want to thank everybody who's tuned in. Thank you for watching this. Hopefully, you've got something out of this, and it's helped you be able to hopefully get your life back or be able to address the issues that you're really taking a look at. I do want to thank Surterra for providing not only the people here, but also for sponsoring. It's really important. I think it's a quality dispensary. Take a look at. Naturally, if you're looking for a medical marijuana card, I recommend MMTC. And Dr. Beasley and Amy, I'm going to echo what you said. It's not a matter of getting your medical marijuana card. It's a matter of what happens after you get that card. Do you get the support? Do you get the help with dosing? Can you call someone? That's really, really key, because I've run into a lot of people that have got the card and come to me and say, Mark, now what do I do? And that's really, really critical. And really to have a doctor, a practitioner, or someone to rely on is really, really important. I think that's the key. That's why I recommend MMTC. I'm going to point out that there is an organization in Pensacola called the Blunt Joint, run by Manny Alfinas. He does a great job. He's a ex-veteran. He worked for Surterra for a while, and he actually helps a lot of people with medical cannabis. He's there to help with educational services. It's something you may want to take a look at. And last but not least, I want to point out, thank you for this webinar. It's the last one this quarter, but we're planning another series this summer, which will be fairly educational. But please check out our YouTube channel, YouTube/Marijuana Aware. This video will be out there by the end of this week, and it also has a bevy of information if you're looking for medical cannabis that can help you very much. And last but not least, I want to thank a couple of people that without their help, this would not happen. And that's Lee Jones and Leah Wagner. They did all the work in the background, all the graphics and things like that. Really, I'm just here to really present what they produce. So thank you very much for that. And I want to thank them for their time. And thank you for joining us. Like I say, we'll have a new schedule coming out pretty quickly. Pay attention to YouTube and also the Reels. And I want to thank everybody for joining me tonight. It's been kind of a fun night. I didn't know how it was going to turn out, but it's been very informative. So thank you very much.